Alright. The queue was really heckin' long for a normal queue. So I clocked on to Dr. Q, which means, at least for the first bit, I'm gonna be probably in Sandy. Especially if my truck's there, and if my truck's not there, I'm gonna go to Sandy first. Anyway. These locals really need to decide if they're gonna let us keep our toolboxes or not. Ooh, headache. Goodness. Turn my peaceful mode on. Alright. Time to get clocked in. Let's see. EMS, probably Eclipse. Sandy. Let's see where people are. The heck is that? Somewhere. Yep, Dr. Mulkey. Okay, they're fine down there. I can probably stay clocked on up here for a bit. Let's see. Scrubs on. Turn my caps lock back off. Get all my stuff. Just in case. Radio check. Hello. Anyone on Dr. Radio? Do I need to mumble? Dr. Fera, 1041, Sandy Medical. It would be nice not to have to run to the back dumpsters anytime I need to throw something away. Do 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 do. Text Santi. So I'm going to take the to be Do I have my radio? Yeah, it's on. Yep. Lar. Oh, people? People to actually work on? No, they leave. I'm so sad. ¿Dónde están mi people? Where's my radiation? Psych. That's definitely one I could probably take, but it's EU time. That's one I could probably take, but it's 9 days ago, so I don't know if he still needs... Oh, Fang. That was literally just a bit ago. Person? There goes a person. Okay. Okay, she's on a ride along. Viv is EMS. There's Ellie. Still. God, what the heck is going on there? Yeah, I might need to go down to Eclipse. Mark myself 10-7. Put my belt back. Is that... Keep my radio in my ear just in case, and I'll just have to bring it back up here later. Yeah, because they're swamped with PD right now. Santi, never mind, I'm done. Well, this truck is weirdly whippy.
Doctors from PD.
Send it.
Could we possibly get one more up here to help Ellie?
We sent in the ICU.
Dr. Fera is en route to Eclipse from Sandy. However, it will be several mics before I'm there.
You're good. We got enough. It was just, I just needed one more set of hands in the ICU. You're okay to stay from Sandy. Words are hard, I'm so sorry.
You're good. I saw there was a lot of... Sandy's kinda dead right now anyway, so I figured I would come down just to be an extra set of hands in any case.
Oh, yeah, if you want to. It doesn't matter.
Yeah. It's good to know they can hear me. Got the burps. Don't honk at me. You're the one driving crazy. Gonna do doctor stuff. Yeah, yes. Pretty sure this is my full of stabbies. Yes, it is. This has garbage in it right now. Okay. Any fooch? Fooch for Indy? Of course not. Throw all this away. Or at least what of it I can carry.
You know what's funny is apparently I think there's a hole in some glue or something because Jesse and I were trying with some powder yesterday and even when we had all three on we still I don't know why. I think she already told you, but yeah.
Some saline. 2 of those.
I'd say probably beware of those baggies and stuff that are in the bed too. Yeah.
My things. Whoop.
It is. I was
You
working
okay?
as the only EMS earlier, and it was
Oh no.
yeah. I only really went on duty as a doctor to do an autopsy, and then and also figure out medications. But yeah,
Yeah.
yeah.
You're doing great. I believe in you.
Thank you.
Mm-hmm.
You're doing your job.
Yeah, I'm trying.
You're doing good enough that I don't have to have a discussion with you.
Hell yeah. That's the
I'm
important
so
part.
proud. Yep,
Yeah.
that was a very important part.
Mm-hmm.
So proud.
That's kind of what I think for EMS. Especially with some of the tea I've been hearing from them, I'm like, Jesus Christ.
Ooh, is it Tifo?
Ooh, is it a bad time to ask for a doctor? Oh, you're okay. You're okay.
Oh no, it's
There's
fine.
someone in the ER.
Okay.
Oh, okay.
You? Since you've had nothing to do for the
Yeah,
past forever?
I'm absolutely
Okay.
down.
Okay.
A
Alrighty.
patient,
Run,
yay!
go!
Hey there.
Oh, hello.
What seems to be going on with you?
I have a bullet graze on my head that is wrapped, and I was shot in the back in my vest. I do not know if it.
Mm-hmm.
I do not know if it was punctured. Or punctured my back. I'm definitely bruised. It hurts.
Yep. All right, let me get you started on an IV with just a little bit of painkiller in there, and then we will hopefully get that vest off and see how that bullet treated you.
Can you make sure my face is okay? I'm an actor.
Yeah, absolutely. All right, gonna be just a quick 3, 2, 1 poke here for this IV.
Ooh.
Mm-hmm. And then let me take a look at that face for you. Well, sir, I will say you are exceptionally handsome. I don't believe you have
Oh.
any scratches, nicks, bumps, or bruises to this face of yours, so your
Thank you so
moneymaker's
much.
fully intact.
Excellent.
All right. Next up, let's get this vest off of you, and I can check the back and see if there's any
All right.
bruising and things like that. Alrighty. It looks like you were right. You absolutely do have some heavy bruising back here. But in good news, I'm not seeing any place where any bullets penetrated and got through your skin or into you anywhere.
I'll be able to walk again.
Oh yeah, absolutely.
Oh, thank goodness.
What I'm gonna do for you here is just apply some bruise cream to these exceptionally dark places.
Ooh.
And then
Can you warm it first?
yeah, I can warm
It's
it
a
in my
little
gloves.
cold.
That's fine.
Thank
Yeah, I
you.
can do that.
I've had the cream when it was cold on me before. It is very cold. Thank you so much.
Yeah, it's no problem.
Ah,
All right.
very nice. You have a tender touch.
Well, thank you. I certainly try.
Thank you so much.
All right. Were there any other places besides the back? I think I remember you telling me about a graze
think-
somewhere.
Oh yeah, it is wrapped on my head.
Oh, wrapped on your head. Gotcha. Alrighty. As far as I can tell, and you said your head was feeling good, and I said it was looking good, so if you're
Yes.
feeling like you're all good, you should be able to roll on up for me.
Excellent. I think I am all right. Thank you.
Yeah, no problem.
Oh. I fear maybe cuffed to the bed.
Mayhaps. Yep, if you're a little... Sometimes the beds are a little sticky if you're in handcuffs. It just depends.
I think yes.
Here, I can stand clear if
Sorry.
y'all want to... Sorry, excuse me.
Tori, my
well,
face wasn't damaged.
Tori, he's yours.
Face
Oh, we'll
was not damaged.
Bring him down to
It's
Dave.
not
We'll go bring him down to Davis.
Okay.
Did you park down
Well,
below or above?
Outside.
You're outside front? Okay.
Yeah.
Well, I'll
Can
meet
you
you
get my
out there
tacos
'cause I'm
and
down below.
horchata?
I have your taco. Well, actually, I just got a taco from some random dude outside. So
has my
he might have
tacos.
drugged it because usually people drug food they give to cops.
Oh, well,
You wouldn't know
So
anything
was it-
about that, would
is
you?
it carnitas? No, I have never drugged food.
This is yeah, it's actually a asada, not carnitas.
Oh, that was not the
Carnitas?
one I ordered.
No. Who do you order the food from?
The man in the taco truck. I do not know.
Okay, well, we're in the hospital right now, Sherlock.
No, but
This
he was
isn't
just injured.
Jamestown.
He was just here. He was also
Okay.
shot.
Okay. Have you been treated? Have you been feeling better? Because I could just bring you. He might be still outside. I could just ask him for you.
I am better.
Okay.
I may be cuffed to
That's how I feel.
Yeah, how have you been feeling, by the way? I think you mentioned that you had been sick for a while.
So I'm gonna come down on your level.
Alright.
I have pretty chronic migraines right now. I've had them since 2021 when I got the big sick.
Oh, yeah.
They flared up really bad when the weather was like rapidly changing from cold to hot. Those have kind of calmed down, and then I think like 2 or 3 weeks ago I got a really bad sinus infection. But that's kind of mostly cleared up. I'm still phlegmy from it. But I have another appointment on Friday. But I'm mostly feeling better. I very much so appreciate you asking.
Yeah, no problem.
My migraines are mostly under control, which is a lot better than it was.
I wasn't shot in the back.
The migraines
would
were
have
a
been
really
caught.
big problem.
Well, I don't know. Maybe don't get shot in the back, forehead.
I was.
Yeah, you tell him.
It's like a
Good luck,
claymore
buddy.
facing the enemy.
Jesus. You got shot in the back? Alright, good luck, bucko.
Yep. His vest took all of it. He just had some pretty bad bruising. He'll be alright.
I'm sure I'll be fine.
Yeah.
It's like a lot of GSWs that I get around on the field are either, oh my god, they're through and through, or oh my god, they're lodged, or oh my god, they took it to the vest.
Mm-hmm.
It's never anything fun like, oh my god, this bullet has ricocheted off of every single rib in their rib cage and lodged itself somewhere within their lungs or their pleural space.
Oh god.
Within the lung cavity. It's never anything like that.
think it's been a while since I've had someone's bullet go in their lung.
Mm.
A
Tell
lot
you
of the times
what.
it's to the shoulder.
If I ever get shot, I'll make sure it's fun for the doctor doing surgery for me.
Oh, great.
I'll make sure it ricochets. I'll shake myself like a maraca for y'all.
Thank you so much.
No problem.
Just tell the EMS that responds to shake you up, and then I'll have to go and be like, "Why did you do
Yes.
that?"
Shake me like a salt shaker.
Yes, exactly.
Shake it like a Polaroid picture.
Yes.
No,
Shake me.
now that's stuck in my head.
Shake it, shake it, shake it.
See, the Sosuke's got arrested.
Yeah.
Was it for the
Good.
Cluckin' Bell stuff, or was it for something else?
I don't know. I don't know if the one that injected me with ketamine ever got charged. Honestly, one of the reasons why I put my hair up in a ponytail was so that they didn't recognize me. I'm gonna be honest, they're not the brightest.
No, most definitely not. Bless them.
The only time I've gotten hurt today was getting beat up by a local.
Nice. Well, not nice, but given track record, not bad.
Echo 142, 1031.
Will do. Welcome on board. I'm pretty sure Viv was getting mad about it. Understandably, but I literally...
How's the city looking today?
Oh no. PD's getting mad because I told them that they should park their shit downstairs properly.
Arnor.
Ooh.
I might have taken a picture of some of their bad parking, and it was over the spot where we had to valet our extra shit.
Maybe they should not park like assholes at our hospital.
Yeah. Like, why do we need the whole cavalry downstairs and with their cars all over the place? Just valet your
Aria,
shit.
come lie with us.
Hey, Aria.
I'm dying.
We're not
Hi.
dying. We're just rotting. We've decided it's a good idea. I'm still stuck on the shaking thing.
We're gonna.
Anytime one of us gets shot, we're gonna ask to be shaken, so
but not stirred,
so that whenever we're brought in, our injury is far more interesting.
What in the world? Are we just having a little cuddle puddle over here or something?
Yeah.
Yeah.
We're rotting.
Oh my god, there's another EMS. Although I'm not. Oh my god, I've been 10-7 so long. Oops.
Damn.
But oh my
Viv.
goodness. Well, I had to do an autopsy. And I just forgot.
Ah!
Ooh.
Sounds
my
like
god.
you might have to do another one.
God.
Yes, run toward the explosion. That's a phenomenal idea.
I worry about many of the city's inhabitants having very little... There's a term for it. Self-preservation. Thank you. Yes, exactly.
Thoughts? Past. Ooh. Boom. Must go look.
Honestly, that too. Not gonna lie.
FOMO?
Did you say FOMO?
Yeah, fear of missing out.
True.
I told one of my therapy people that they have FOMO, and they were like, "Yeah, you're not wrong."
I made it.
I said, "FOMO's not a bad thing, but FOMO can be very dangerous." He's like, "Yeah, FOMO got me where I'm at, dog."
Wow.
Wasn't any explosions out front.
Oh.
It was probably across the street from like right at where the crane is. There's a car that hits something over there and it blows up on occasion.
When I was outside smoking a cigarette, I was watching cars slow roll.
So anyone got any fun plans for Thanksgiving?
I already had Thanksgiving.
You did?
Canada. Canadian.
Oh, that was like a month ago, wasn't it?
Mm-hmm.
Well, hey, I'm not gonna tell anybody if you don't. If you want to get another round of turkey and some mashed
I would
potatoes,
love some.
gravy. I think there's something happening up in Grapeseed tonight. Looks like
Grapeseed is doing something?
there's a event on the calendar. It says Thanksgiving at Grapeseed
Ooh,
in about
okay.
2 hours.
I'll stuff with my face with some turkey.
Heck yeah, I like
Heck yeah.
turkey.
Love a good feathery bird in my face, right?
I. God, fuck. Oh my god.
What did I say?
That's contagious.
Y'all okay?
No.
Does it smell like rotten eggs or something to you guys?
Oh, Jesus.
You got a case of bacterial laughing-itis over there.
You broke Ellie.
My God.
Oh, that's Ellie's. Okay.
You broke your HR. Congrats.
You know, I've had a patient with bacterial laughing-itis one time. They couldn't stop laughing for about 30 minutes. Gotta get them on straight oxygen.
Oh, jeez.
I thought you were gonna say you put them on antibiotics.
Okay, goodbye.
Where do you think you're going? You're not. You look like you probably aren't good enough to walk right now.
I'm trying.
Are you drunk?
No, I have a brain injury.
Well, that'll do it.
That was good.
Ma'am, are you okay over there?
Oh,
I haven't heard somebody gobble like that in ages.
Oh my god.
If I'm known for one thing, it is my laugh.
Frontal lobe brain injuries cause balance issues.
Oh my.
Yeah, it's not the brain issues contagious, the laugh's contagious.
Oh, yeah, no, the brain issue's not contagious. Just
No.
get hit by a car like I did, then you'll probably get one.
Why'd you get hit by a car? That doesn't sound like a smart thing to do.
Blame Johnny Sosuke for running me over.
Oh, jeez.
What, did he run you over and then inject you with ketamine? Because that's what
No,
it sounds like.
He had his brother come in to him and his brother stopped by the hospital and he ordered his brother to inject me with ketamine after he called me a snitch.
Oh.
Wait, he called you a little yellow thing with wings? People on brooms try to catch you.
Are you do you genuinely just not know what that is, or are you joking?
Well, isn't that the snitch?
That, Viv?
Hmm?
Do I have to bother reading that? Was it anything worthwhile?
Dispensary's moving to Del Perro.
Oh, my husband.
Yep. Oh my god.
Yeah, Sosuke took his charges to bench trial and he got found
you sound
guilty on
sad?
all 3 of them, and I had to go and testify. So
Sounds
that's
sad.
why I'm a snitch.
Okay. So not the one from Harry Potter.
No.
Ah, gotcha. You know, Halloween just came up. You could have dressed as one.
God.
I wasn't in the hospital when Halloween was.
All right. Favorite Thanksgiving dessert. What would you guys say is your favorite?
Pumpkin pie.
Pumpkin pie.
Dessert.
All right.
I like cheesecake.
What the hell is he calling you?
Okay, cheesecake.
Does not give me
My
life
vote
for
is
fun.
for carrot cake.
Oh, that's a good one. That's a really
that
good one.
is a good one.
Cheesecake's also good.
All right, what about you, Viv?
Thank you.
Where are you? I guess there's something like that, but with like pumpkin. It's like pumpkin bars. Pumpkin bars, yeah.
Mm.
Ooh.
So, anytime there's a family feast that I go to, sopapilla cheesecake, hands down one of my faves. You guys ever had a sopapilla cheesecake?
I don't think so. No.
It's like
Nope, I
cheesecake,
haven't.
but with like not pie fillet, or not pie crust, but it's got like cinnamon sugar coated on top of it.
I'll be
And
back
it's
in a
got
little
like
bit.
a little tiny like breading on top of it as well, and it's about like an inch thick. It's hard to describe. It's the most delicious, second most delicious thing you'll ever put in your mouth, right behind a Brazilian roasted pineapple.
I was gonna say something very not well.
Go ahead and say it. We're all
No.
adults here.
After the feathery bird comment earlier, I was also concerned what you were going to say for the first thing.
Oh, Indy.
Yeah.
I applied for doctor because I don't work as a vet anymore.
Oh, okay. Nice. I hope you're
I'm
able to get
very
in.
much avoiding the vets right now.
Why are you avoiding the vets?
They fired me.
Oh my! What happened?
I've told you, Viv, right? What they fired me.
Yep.
They said that I was making the others uncomfortable, that I overshared, and that they were worried for my mental and physical health, so they fired me.
Oh, well, that sucks. Well, welcome to the hospital, where we overshare lots of feathery, wonderful, juicy goodness.
I mean, everyone I've talked to said what they did was kind of fucked up. Like, in terms of the vets firing me. I don't know. I'm sorry. I keep talking about it. I'm sorry.
No.
You're
so
good.
Canadian. How many times have you said sorry today?
I have anxiety.
Well, no, that's not. I'm just saying that every time I meet a Canadian, they're telling me sorry.
We do say it a lot.
Midwest.
I can't. I am from the Midwest.
Oh, okay.
Like back home,
That tracks.
Ohio. Oh, that's
Oh.
not necessarily Midwest. Fuck, I'm bad at geography.
I mean, I think it technically is.
It's okay. I'll give you a pass to
like-
say sorry.
It's technically like Appalachian. Back home I'm from Ohio, and I can't tell you the amount of times people compare me to a Canadian. Even my friends who are Canadian say you sound like a Canadian.
Oh, I thought you just said you were Canadian. I mean, I just mixed you up.
No.
No, I'm the Canadian.
Ah, okay. Okay.
I just have chronic anxiety.
No worries.
But yeah, no, after crying my eyes out from getting fired, I'm moving on and going to try and become a doctor.
Okay. What does your recovery time look like on your brain injury there? I think that's probably going to be their only concern.
I don't know. I've been here for a couple of days now. I'd have to ask Sleepy if she wants to do any more tests or anything.
Oh, Sleepy, she's a good dog.
Yeah, when she... I'm gonna be honest. The vets feel very clique-like. Sort of. And if you're not, like, within that inner circle, it almost feels like you don't really matter that much. The last time I talked to the person that fired me before I got fired, he said that I needed to grow a thicker skin. Hello.
Mayor,
Hi
can you
there.
say that one more
Hello.
time?
Hello. Where the fuck
Hello.
is
Do y'all require
Welcome to the
medical?
hospital.
We are looking for a friend.
Where the fuck
Oh.
is he?
I don't know.
We've not seen anybody come through here in the last probably 10 or 15 minutes, to be honest with you.
What the hell?
Mhm.
How did we beat them here?
He didn't. His car was right there.
Can't you track them?
Yep, we've not got anybody in the ER or
Right up and
anything,
at
so
him. Got it.
All right.
2 months?
Appreciate it.
yeah, no
What
problem.
in the world kind of rehire policy is that kind of crap?
Yeah,
I know. That's like.
he said I
I've-
could reapply in 2 months, but even then I'd be on a trial period to see if my mental and physical health has improved.
Yeah,
I'm sorry,
that's
buddy, but when you have chronic severe trauma, it's not gonna heal in 2 months.
yeah, you know, it sounds like the vets to have some bull excrement, right?
Mm-hmm.
Oh, they're dicks. And it's fucking bullshit. And then I get a text from Anna saying, like, it was a hard decision, yada yada yada, we were really worried about you or whatever.
Mm-hmm.
And I'm like, if you were worried, you wouldn't have fucking
Hey
fired
there.
me. I went on.
Hello.
Hello.
You want
We
to come
kinda,
join the cuddle puddle?
well, we kinda got drugged last night and kinda just needed just some quick checkovers.
I gotta
Oh, jeez.
stare at a wall.
All
so
right.
I'm gonna...
I
Hi,
just
everyone.
remembered.
Good to see you.
You
Yep.
can hang out with me. I don't got a call yet.
Here, if you'll come back into the ER, we'll look you over.
Mm-hmm.
Yeah.
You know what kind of drugs, or was it?
Honestly, it feels like a
I don't
really
know.
long night out. So,
Yeah.
but
You were
I
standing
don't.
there, and then all of a sudden,
Yeah, the rush to the head. Yeah.
yeah,
Ooh.
we said something about boo praying mantis, and all of a sudden,
Yeah.
our head just started hurting.
Do you know if there was any report made on y'all's OD or anything like that?
It was pretty quick to go over it.
Yeah, it was during a bench trial.
It's not like when I got drugged with Ket. Yeah, like literally by the time someone came to check on us and grabbed the Narcan off me, it passed.
Okay. Yeah, I'm not seeing a report or anything. We'll just check over your vitals and all that kind of good stuff and maybe run a quick tox to make sure there's nothing left in your system. And then I'd say you're good.
Yeah.
Yep. If y'all don't mind to each take a bed, we'll get started on that tox and then get your vitals looked over.
My bed. Nice.
Oh yeah, I think I found the report, by the way.
Oh, you did?
Was the 25th? Today's the 27th. What is it? Was it on the 25th?
Technically it was today.
Okay, so the 25th would have been the Ket thing, probably.
Yeah, this was not like how it was.
Okay.
Like the symptoms. This one was just like rushed to the head, got nauseated.
Okay.
I only collapsed once, so it wasn't as bad.
Do you have syringes on you?
Syringes for...
Just for the blood draw for the tox screens.
I
If you don't,
have any on me, I can
all right, I'll grab some.
Oh, all right.
Very exciting. I'm gonna die.
The winch.
Pissed off more than anything.
Oh, it's okay.
No, you're not feeling better.
There you go. Still got the cap on it, so
Oh,
it
now
should
I
be
feel
safe.
Yeah.
Yep,
Oh,
yep.
Okay. Alright.
Oop, sorry.
See, if you don't mind me, I just gotta inject you with some blood, or get a needle for some blood there.
Not inject me.
Well, I mean,
All right,
the
I'm
needle
gonna
and
take a
get the
little
blood
vial of
out,
blood so we
alright?
can get this talk screen going.
I was gonna say, not the other way.
Yeah.
Okay, so I'm guessing you have a slight fear of needles?
Gonna be a quick 3, 2,
Okay.
1, and poke.
Alright, if you want to look away there, like, oh my god,
All
there's
right.
a bird!
I'm gonna go get this talk screen started, then I'll come back and get your vitals,
there.
okay?
Yeah, just...
I kid you not, the EMS and the doctors here are very
Analyze blood sample. Blood.
I got the blood.
Awesome.
Knew the bird thing would work.
Alright, I'm not seeing anything on hers, but I'll double check the report when I get back in there.
Oh god, Travis. Someone might have alcohol poisoning, Indy.
Okay.
Nice and comfy in the bed here, okay, sir? Oh, well, you got it yourself.
Oh, you get me in the. Well, I did it. Sorry.
All right. Well, I got a doc here who's gonna come check you out. Hey, doc, we got one gentleman here who's got at least he was brought in and checked in with signs of alcohol poisoning. He is
All right.
responsive.
I had 4
Alrighty.
drinks in 3 hours, and
Oh my
apparently
God.
that's far too much. Everyone
Alright.
else can do it, but not me.
Alright, so what I'm gonna do here, just to kind of help you get this alcohol out of your system, I'm going to set you up a pretty hefty saline IV with some lactated ringers, and that should just help you get the alcohol out of your system, okay?
Okay. I hate needles. I hate needles so much.
Yep. It's okay. What I can do, if it'll make you a bit more comfortable, I can put a little bit of numbing cream where I'm gonna put it, so you won't feel the poke.
It's not the feel, it's the fact that I know it's there. It's not.
Oh, okay.
I don't like things inside of me.
Gotcha. How about this then? I'm going to put up a little bit of surgical paper between your arm and your head. Honestly, all it's going to do is kind of block your vision. Yeah. So it shouldn't take but a second. You might not even feel it. It's up to you.
Okay.
I've got a dear friend of mine that's very scared of needles. And it tends to help her out a little bit. Like, no countdowns, no anything like that. Just yapping back and forth and seeing if you feel anything and if not.
Yeah.
Oh, hey, Allie.
I feel something.
Yeah.
Yeah.
Hi.
Feels
Hey.
alright.
What's up?
Harvey.
Alright. I'm gonna let you kind of hang out just a little bit. Because I've got a quick talks thing I need to do for a PD member. But if anything happens, have one of your friends grab me. I'm Dr. Fera. I'm the purple one, so.
Purple.
Cool. Thanks.
Yep, no problem. Basically what I've done, I've hooked him up to a bag of saline. It'll take a little bit of time, but it should help bring his blood alcohol level down.
Okay, sounds
Yep, so it'll just take a bit of time.
good. All right.
All right, Miss Walker. I've got your tox results here. Let's take a look-see.
What you got for him?
Yeah, I can imagine.
Basically what I'm seeing here. Let's see.
You know, because you don't do it often. Tolerance isn't that high.
Considering the fact you've been on duty, this is kind of a shocking result, but you seem to have a bit of alcohol poisoning? Have you been drinking a little bit?
No.
No? Huh. That's wild. Well, at least that's easily treatable.
That's good.
Yep. I'm just gonna hang up a bag of saline to your IV right here.
Appreciate you. Sorry.
You're good.
To be fair, most of the symptoms were a good 14 hours ago.
Mm-hmm.
I can't do time. Last night.
Yeah, I get you. So this saline will take about, I'd say another 5 to 10 minutes to empty the bag.
Sorry about that, and thanks for calling that an appointment or something.
But then after that, I don't think there's much else we could do for you aside from giving you a barf treatment. And if you're not feeling bad, I don't want to have you feeling bad by puking up all over the place, if you get what I mean. So
No, that's completely fair. If that helps, most of it's just like a really bad hangover.
all right. Then here, let me do this then.
Me and Bean were just sitting there on the bench, and then all of a sudden.
Sorry.
No, it's alright.
Yeah?
See, just looked at the blood here, and I'm just double checking everything.
Mm-hmm.
So I'm just adding some lactated ringers to your IV here. Basically,
Oh
it's...
no, you're good. I just noticed something really interesting happen. Sorry.
Oh, you're good. You're good. It's basically, I'm just giving you like some super Gatorade straight into your blood here, so maybe your hangover problems will speed away a little bit quicker.
Kind of like those packets.
Super Gatorade's always good.
Yep, we love super Gatorade.
Oh hell.
Yep, all those fun electrolytes and all that. Just be aware you might need to take a bit more frequent bathroom breaks on duty today.
Oh, that's fair.
Yep. All right, same deal. It'll just be like the 5 to 10 minutes, then you should be all good, officer.
Oh yeah, I appreciate you.
Yeah, no problem. How we doing, folks?
We're doing.
I
Doing?
don't feel like I can stand up or anything, but
Yeah. Let's see here.
Let me move out of the way.
You're good. I'm just gonna check over his bags and things, and we'll see. Yeah, it looks like you've gone through this saline bag pretty good. That's a good thing. Alright, I'm going to take out this IV and remove this surgical paper. And I'm just going to wrap a quick band-aid around the spot where that IV was.
Yep.
There you go. Oop.
Okay.
Okay.
Huh.
Let's try that one more time.
Okay, Travis. At this time, I think that you're Sag farming at this point, okay? And,
Sag farming. That's crazy.
Travis, stand up.
What the hell?
What is?
Okay,
I think
now
he's
you're just looking for
trying to harm
attention.
me.
He's just looking for attention now. There you go. All right.
If y'all step back a second, I'm just gonna set you back in the bed, sir.
Yeah.
Your legs might just be a little bit jumpy for a second. Let's see here.
Yep.
Huh. I'm sorry, I don't mean to giggle.
I'm just gonna close my eyes here for a second.
Yeah, that
Do
might
your
be the
thing.
best idea.
Yeah, go take a nap. Okay, all right.
I told 5 to 10 minutes. Hi.
If you're feeling good enough, you're good to roll out. I'll just need to take that IV out of your arm.
I'll offer.
Yep.
Yeah, that way I don't clog up the beds, because I'm gonna be real. It's probably gonna be a busy night. It always is.
Harvard.
Yes.
Alrighty, ma'am. You are all good.
It hurt that much to get out. Ooh, I really was rushing to meet you.
One gesture
Yep.
that they give
No problem. Take care out there.
whenever they stick a
Thank you,
finger up.
Indigo.
Yep.
Be safe, okay?
Can do.
Well, they give me this, and it's like, yeah, that's great. That means okay, right?
Yeah. Yeah.
That's pretty much all I know.
Huh. I mean, that's a pretty good one. Yeah,
Yeah.
like that.
Yep.
I just had a lady out in the hallway doing sign language, but like I was telling Viv, all I know is this, so I'm not really sure what she was saying, but
Yeah. I don't know.
I don't know either.
Anyway, I think I'm gonna go maybe try to figure out these scrubs and if I want to keep doing this, and I'm probably gonna go 42 because I've been on duty for a while.
Oh, you're gonna skip Thanksgiving?
I will. I mean, I might go around tomorrow, but
In the car. To the car we go. Let's go get the snacks.
but yeah.
Thank you guys.
Hey,
No
thank
problem.
you.
Well, yep.
Have a good night.
Stay safe.
Y'all stay safe out there. Make sure you
But
wear
yeah,
your
I've got the-
seatbelt.
Oh, jeez. The fucking ejectocitos. Yeah.
I had a guy out there just a minute ago. I'm pretty sure he had a concussion. He was telling me adamantly that he did not have a concussion. But
Yeah.
then I asked him to spell the word world backwards for me, and he failed that one. And then I asked him to tell me what the first question that I asked him was, and he failed that one too. So
Oof.
I was a little concerned for him, but yeah.
Oh, by the way, there's been a lot of, well, I'm sure you could probably tell, a lot of drug overdoses in the city lately. I think some drugs have become more open. So there's a bunch of Narcan for EMS to use in that bed in the armory.
Okay, good.
Yep. Yeah, and I think
Wait, did they get the did they get the blueberry flavored Narcan by any chance?
I have no idea. I don't think those ones are the flavored ones.
Oh man.
Yeah. I'll have to see about that next time I make
Okay.
them.
Okay.
Or make it in the lab.
Yeah, the blueberry Narcan, people just absolutely rave for that one for some reason.
Yeah.
You know,
My favorite's the orange creamsicle.
orange creamsicle, that's a good one.
Yep, yep. I know I'm supposed to have a PD member come in later to get some Narcan to keep on their person, so.
Oh yeah, I think a bunch of PD's been asking for that.
Mhm.
By the way, fun fact: the Narcan that we have works for all pharmaceuticals and not just opioids.
Really?
We got that souped up stuff.
Yeah.
Oh, that's good. So what kind of symptoms have you been seeing for patients that are like what do you physically see?
Mostly like the unconscious and not breathing. Yeah, mostly that. It's like that, and they don't really have any other like injuries or anything that really indicates why they'd be unconscious.
Gotcha.
That's probably the main one that like hints at it right away to me.
Okay. Oh my gosh, what how did you get right behind me?
Oh my god.
Crash is stealthy.
Holy cow. Hello. How you doing?
I was wearing the wig in hopes that Sosuke would just not recognize me, but now I kind of don't give a shit.
Okay. Wait, is this Soul?
Yes.
Yep.
Oh, okay. Man, you look way different.
Well, this is how I normally look in drag.
Oh, okay. We were admiring a finger painting that somebody posted out there in the hallway. You guys see the finger painting?
No, I
Someone
haven't.
accidentally punched me.
Well, I told you the thumbtack was popping out. I was trying to put the.
No, yeah, I'm gonna go change and then.
Yeah, it's right here.
Oh.
I don't know who did it, but holy
Ooh.
crap! What was
What
that?
was? Oh, was an ambulance.
Status check.
And do?
What just happened?
I just had a tornado go right through the middle of the cliff.
That's
An
a
actual
fire.
tornado or a carnado?
I think the answer is yes.
Ambulance carnado.
Is everyone okay? Am I hearing a fire? To help?
Is the fire underground?
It might be down in the basement. Yeah.
I'm not on duty as either.
Oops, sorry, Crash.
No, you're fine. Oh fuck, I can't go. Never mind, I'll stay here.
Let's see if it is downstairs.
Yeah, it's in the garage.
Okay.
Oh, Jesus.
All right, who?
Jesus
who-
Christ. Not me, dog. Not me. Yeah, the valet is trying to fucking murder us again.
Oh, my
Jesus.
god!
I was in the therapy room.
Did somebody put a bicycle in the parking spot again?
Yeah, probably.
Oh
Yeah,
my
we
god.
really need to just move that shit.
Hmm.
All right, I'll call a mechanic.
Yeah. I'm just gonna start telling the EMS not to put the bikes in them. Or at least try not to.
Going back to the ground floor. Oh. Oh, I crashed. All right, that's fine. Tornado. Carnado. Dun 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 dun.
Thank you so much. Bye. Yeah, I misread her name. I thought she was bronze.
Okay, I can see Crash, so I'm probably good. Tequila. Why was that unlocked? Come on now. Thank you.
Okay. It's fine.
There she is.
Oh. Hey,
Huh?
Doctor.
Hi, how can I help?
What is it, Dr. Indigo, or what's your last name? Which Vertigo.
Either or, Dr. Indigo or Dr. Fera is fine.
Okay. I have some old bullet wounds.
Personally.
Yeah, I can take care of that.
Yeah?
Yeah.
Okay, thank you.
Where did you come from?
All right, you should be feeling all good. Is there anything
Oh.
else you need me to check over?
No. Thank you so much for taking care of those so quickly.
Yeah, it's no problem.
I appreciate that. That was it. Thank you so much, Dr. Indigo.
Yep, no problem. Have a good one. Tulips, me. Pork Palace. Papa Dom's. Who's working Papa Dom's? If it's Rocco, I might call and ask. Papa Dom's.
Except his hair's gray now. See the Johnny
Gray
Sosuke?
now?
Papa Dom's.
It's gray.
Wow, he looks like you just. You know what? I'm gonna keep that to myself.
If it helps, they wear clock and bell hats. That's my friend Thomas.
Oh, okay.
He was probably extremely confused for a moment because his girlfriend's name is Indy.
Oh, okay. Oh, the Indy you talked about, that was in a motorcycle club, if I remember right? Yeah.
They had a Friendsgiving. They were calling it Cultsgiving thing today that I wish I could have attended, but
Oh yeah, I saw that on Twinsta, I think.
I should probably go to sleep. I've been awake for a long time. And with Thanksgiving back on the mainland. Oh god. Was a car on fire down below?
It was, the fire was out by the time we got down there. But, what they're thinking happened is that there was a, when someone tried to pull the ambo out, there was like a bicycle or something stuck in the parking spot, and when the ambulance kind of crashed into it, it caused the subsequent tornado and fire.
Yeah, that's happened where one of the ambulances ended up in the lobby once. Okay, I'm yawning. I think that's a sign I should go sleep.
Do you need any IVs or anything set up, Crash, before you go to bed?
Yeah, can I get, like, pain relief and anti-anxiety meds?
Yeah, I can do that for you.
already have it in my hand. It's just not connected to anything right now.
Yeah, I get you.
Ugh. Even the window's cracked from the wheelchair going flying.
Yeah.
Patrick's. I did not expect to see Thomas all the way down here, to be completely honest.
Oh, yeah?
Yeah, no, I didn't really think he'd be down here, but I guess he did need help, so.
Alright, I'm gonna go 42. Have a good night.
Thank you for your services. You did wonderful.
Good night.
Oh, thank you.
Alrighty there, Crash. I hope you have a good night. And you rest well.
Thank you.
Or why?
Because I'm looking to talk to her about getting a primary care physician.
Oh, hey.
Oh, okay. Oh, hey, Fish. How you doing, bud? Yeah.
I need to... Let's see. Actually, Santi likes the orange soda, so she'll get some orange soda because she's a freaking nerd.
Just
Hiya,
wanted to make
Fish.
sure. Yeah. Oh.
Oh.
Concussion. Yeah. That makes
Concussion.
sense. Hi, Indy.
Hey, boss. How you doing?
Pretty good.
Good.
Yeah.
Oh crap. Do we need to call a vet for this dog? He's quacking like a duck.
I think that's his speaker.
Oh, well, he's got a huge honking dent in his head. You see that?
Yeah.
What in the world? He's got a dent
No.
in his head. Do we need to call him a vet?
No, they know. I called
Okay.
Clonk.
All right.
Yeah.
Who the heck is Clonk?
Well, he was quacking like a duck.
Oh, Clark? Okay. I know Clark. I didn't know a Clonk.
You're good with allergies, right?
Huh? Sorry, say
You.
again?
You, allergies.
I do have one, yes?
No, you're good with them.
Yes?
Yeah, okay. There was someone in here that was like looking for specifically that, and I was trying to find you, but when Fish walked in, I was like, oh no. Let me try and find them.
That was the most roundabout way she could have gone about asking me that question.
Yeah.
You're good with allergies, right? What do you mean? I mean, I have one. Actually, I need to make sure that's on my medical profile.
Yes, might be important.
Yep, it is.
Oh. I don't know where they went.
Well, hopefully they come back. Hi there.
Hello.
How can we help you?
I was driving past, I guess, a gunfight earlier, and I got a few grazes. I was wondering if y'all could take a look at that.
Yeah, it's no problem. If you want to come back to the ER, I'll take a closer look and I can get you all patched up and stuff.
All right.
It's just right through here.
All right.
Whichever bed you're most comfortable in.
Just pop down here.
Alrighty, let's take a look at these grazes. Let me check and see if there's any that might need any kind of stitching. But if not, I'll just go through, bandage them up, clean them out, and you should be good. Oh wow, my first nat 20. Wow, they're looking really good.
Yeah,
I'll
I got the hell out of Dodge.
Yeah, I don't blame you. Alright, since they don't require a ton of intervention, I'm just going to put some antibacterial creams on where they scraped you. And then from there, I'll just put a couple little bandages on there so they don't get any dirt or nothing in them. And you should be good to go, ma'am.
Appreciate it, Doc.
Yeah, that's no problem. I'm glad you came to get them checked out.
Yeah.
Alrighty.
All right. Well, thank you kindly, Doc.
Yeah, no problem.
Dr. King, please go
You
ahead
have a good day now.
You as well.
Good night. Thank you for your service.
Oh, good night.
Indy.
Yeah,
Indy.
yeah.
Oh, Jasper.
Hi, Jasper.
Bit of a boo boo.
Yeah, Jasper. Yeah, whoever treated Jasper didn't quite, you know.
Oh, I see.
Clean her up all the way. Oh, that's why, yeah. Yeah, EMS have a tougher time with that.
They flew out a window.
Oh no, that's not good.
Oh no.
No.
Oh,
Do you need any band-aids or anything while I got you right here? I should have your paperwork all filled out. It should be good now.
I think I'm okay. I think they bandaged my head up because I got some glass.
That's not good.
Yeah.
On my head. Yeah.
Yeah.
My pupils look okay today. They were a little slow yesterday.
Yeah. Hang on, I can check your vitals right quick if you want me to. Just to double check your pulse is doing okay.
Yeah.
Okay.
Just breathe evenly for me and I'll get a good listen in on that ticker right there.
Okay.
You're sounding good to me, ma'am.
Good. That's good.
Hmm?
I think Andre went to jail.
Oh, okay.
Yeah.
Hmm.
Oh, he didn't go to jail. Oh, that's sweet. He said they didn't arrest him because he stayed by my side at the hospital, which showed he cared. I think I flew out of his vehicle.
Oh, goodness.
Well, I would hope that if I fly out of somebody's vehicle, they would help me.
True. One would
How was your
hope.
day?
Mine's been pretty good.
Yeah, it's been a quiet day today.
Yep. I woke up, went straight to doctoring, and
Oh.
I was at Sandy for a while.
Did
Why?
you find your truck? Your food truck?
Nope.
Nope.
Oh my god, we looked like everywhere. We went to Sandy and we checked the license plates on like 6 different food trucks. And none of them were right.
Yeah, I don't fucking know, man.
They were also, we're not at the red garage and it's not the one on the south side on Grove Street.
Yeah.
Hmm.
I don't know where it went.
Hi, daughter. What's up? Hello.
Did you hear it disappeared from Hayes?
Yeah, that's what I've heard.
Yeah. Jules and I have detective outfits. We're gonna find it.
Well, I wish you the best of luck. My hope is that it's not waterlogged somewhere, you know?
Really fucking
Who
convenient.
can get it if it's waterlogged?
Probably you would have to call a tow person. And you would have
Oh.
to hope that, they can grab it out of the water.
I thought Jules said that maybe the state could get it.
Maybe.
But it wasn't impounded.
Mm-hmm. That's the part that concerns me, is that it wasn't impounded. Because if someone had towed it and it was in the impound lot, we would know.
And I asked the tow tricksters and they said they didn't see it neither.
Yeah. We put out a 311 last night, so hopefully PD is still looking out for it too.
Oh, I hope so.
Yeah. Because,
That's
you know,
so
they
weird.
cover just about the entire island. So,
Oh, yeah, that's good.
yep. So we can hope.
Yeah, I really hope we can find it. That's so weird.
Mm-hmm.
Okay. I guess I better find my car. I know. I think where it is. And then I will find your car. Your truck.
You're doing great, Jasper. Thank you.
Oh, you're welcome. Oh, look at... I feel more spry now.
Maybe. I don't know.
I could only walk very slowly yesterday.
Mm-hmm.
See you.
Bye, Jasper. Stay safe. She has the tattoo. I just saw it on her back. Wicked. I mean, at least Indy's gonna be getting some money. But the reason she came to Eclipse was because Sandy was dead, and now all the doctors are either in polio or I didn't want to be alone, but now I'm alone, except for Boss, who's in the back taking phone calls. Yeah. Yawn. Me duermo.
You gave yourself a speedball. I feel a little speed in me heart there, Captain.
Hey, y'all.
Me co-captain's been he's been playing darts with syringes is what he was doing.
Oh, I see.
It was an accident, okay? I can't see a thing.
Captain, that's not how we get away from the Port Authority, you know. I mean, it worked.
I mean, it kind of did work, Captain. They did let us go, didn't they?
Well, I mean, what would you do?
I woke up and it smells like.
They're like, "Oh, you just get out of here."
Well, that's the thing. You're standing there, and then you pass out. What's gonna happen? Right there, Captain.
Alright, let's take a look here.
I can't believe you did that, Captain.
Oh, it's not me fault.
So you said darts with syringes, you say. Did the syringes happen to have anything in them?
They may have had a few things in them.
I see. Do we know what those things are so maybe I can
Only
treat
very
you a little bit
wearable
more
ones, remember.
effectively?
I still feel the effects of the adrenaline in my system, plus a little bit of fentanyl.
I see.
What any charm, Captain?
I didn't mean to.
Alrighty, since it was Fent, I'm just gonna push you with a little bit of Narcan here. Hopefully that'll get that fully out of your system, and then the rest we'll take care of with some saline, okay?
Oh, you love saline.
Mm-hmm.
You know, you just have to bottle up the ocean water, Captain. You don't need the fancy saline.
I do not there. You just use the seawater.
Aye. You just find, especially the stuff right by the orcas there, it's the freshest.
I hope my vision returns, because I can't see a thing.
Well, I'll do my best to help you with that too once we get some little helpers in your system.
I'm already feeling some stuff going in right now, I believe.
Mm-hmm. This is just the bagged saline. That should be helping you out a little bit. Let's see here. If you're still having some trouble with your vision after I kinda help you scooch to your feet a little bit,
Yeah,
your friend might have to help you get toted back outside, and maybe that'll help with your eyeballs there.
Aye.
Mm-hmm. And if that doesn't help, come back and see me, yeah?
Aye.
Aye, Captain, I gotta be your eyes now.
I do.
Teen eye pirate now.
Oh.
I can see a little bit now. I'm doing
can you
fine.
see, then?
Aye.
Do you need another,
I had hand me,
slap?
Captain. I'm fine.
Do you
I
need
just
another slap
a
of
little
Narcan?
adrenaline and a little bit of Ow.
There. You can sit on the floor then, being all fine.
Oh, you may need
Let
to
me
help out.
see. Yep.
Echo 14276, latest 47.
I did have this problem with a gentleman earlier. Unfortunately, it might be resolved by taking a little bit of a sleep.
Aye.
Yeah, I'm sorry about that. It was the only way I could get to help him, so.
I suppose I could take a little nap there. I mean, the adrenaline's still coursing through me veins, but maybe I can sleep.
Aye, aye, Captain.
Just think of swimmers nagging you about how you shouldn't be a criminal anymore. It'll lull you right to bed. There, perfect.
There he goes.
Aye, it's always the Port Authority. Aye, why are you being pirates? Why are you doing the plunder? On and on and on.
Mm-hmm.
It'll put anyone to sleep, really.
Fair enough. I didn't realize Los Santos had a port authority, but, I mean, I guess we do have a PD department on a pier, so I guess it's not too far off.
Well, that's that, exactly. Basically, all of them are the Port Authority, really.
Oh, I see. Yep, I'm picking up what you're putting down.
Aye, we've landed here, so this be our port.
Fair enough. Hope the waters weren't too choppy for you there.
Well, we sunk our ship, so maybe. But it's been pretty good.
Yeah.
And look, just today, what did I do? I plundered a watch from their vessel, an evidence bag. And me co-captain here jabbed himself with 2 needles so that we could escape. It's been a good day.
Honestly, I'm glad that worked.
It worked pretty well.
Excuse me.
You're good.
Hey.
Hi there.
How you doing, man?
If you don't mind to put him on bed 2.
Oh, 2, my bad.
Yep,
Okay.
you're good. We've got a couple
me,
patients
not
that
me,
are
not me. I'm okay.
You're all right.
It's been that kind of day.
It's been that kind of day. Yeah, you're
I'm
no
gonna go
no
check on her,
problem.
okay? I'll be right with you, Sammy. 1 second.
Alrighty, let's see. Can you hear me, sir? Are you with me?
Yeah, dog.
Yeah? What happened?
I got crashed into riding my bike, dog.
Oh, I see.
But just like a small little bump, like they just bumped me in the back, and like I was already hurt from getting punched in the face.
Oh goodness. Yep, I can see that. Don't blame you for needing a little bit of bed rest there. All right, let's see here. I've put a
I was
couple ice
actually
packs.
on my way here, and like
Mhm.
you know, it happened.
Yeah, it's no problem. I've put a couple ice packs on your leg. Hopefully that should help you get to your feet here. How's that feel? You need any more band-aids or anything?
Whew, you know that. Whew, little sore, but you know I'll live. Some little cuts, but expected. You know, after being in a little minor crash like that.
Mm-hmm. Yep, I get you.
Just gonna lay here for a second, if you don't mind.
No, I don't
Oh,
mind.
thank you, doctor.
Yeah, no problem. Your first mate's around here somewhere. I believe he's your first mate, right? Or your co-captain. I apologize.
Oh, you were saying something to me, doctor. I'm sorry.
Oh, you're good. I was just
My
saying...
ears are feeling a little bit bad.
Hang on.
Hear me here.
Oh, of course I can hear you here.
Well,
But I
I'm
can
just
hear the doctor here.
wondering. You
I was
mentioned
just
it
saying that
person.
your friend was around somewhere. That's all I
Oh,
said.
yeah,
That's right.
thank you. I hear. I don't know. My ears were. Oh, you know, it's the fentanyl, I believe. It's still in me system a little.
It's all right. The acoustics in the ER can get a little funky sometimes.
Oh,
You're not
I
the only one. Mm-hmm.
I see. I see.
Yep.
Well, thank you.
Yeah, no problem. Y'all stay safe.
Aye. Captain, what are we doing?
Hey, what's up?
Hello. Sorry I missed your call. This is Dr. Fera with Sama.
You're good. You're good. I called the other one, but if you're there, I'm about to bring my boy, and I think he's addicted to ketamine.
Oh, okay. Yes, I'm at the hospital.
Yeah, I'm not sure if he's addicted or depressed or whatever. But he's been doing a lot of ketamine, and he ain't been himself.
Alrighty. If you want to bring him to the ER, is he currently on ketamine, or is this more
I
of
don't know. Y'all should probably drug test.
I can definitely do that.
All right, cool.
All right. See you in a little
All right.
bit then.
Bye.
Bye.
All right, dog. Thanks for the help.
Yeah, it's no problem. Stay safe.
I got 14276 back to Eclipse, one patient. Doctors from EMS.
Send it.
One patient inbound, large gash on their torso, has been packed. They did pass out on me. We are en route.
Affirm. Doctors will be waiting.
I got 14223 Eclipse, one patient.
This is likely going to be a surgery.
Commit arson here at the hospital. Okay.
might do because I do want to get terrorism one day.
That's lovely to hear.
Terrorism.
Well, you know, you just go and visit parks if you want tourism.
No, terrorism.
I'm just gonna have the doctors look at you, bro.
Hey, we got one patient here, large gash to the side. She did pass out on me, lost a lot of blood. Got her started on some lactated
All right.
compression bandage stuff here. She's speaking some really interesting words. She wants to be a tourist somehow.
No,
Oh,
I wanna commit terrorism.
So she wants to be tourism.
I wanna burn down the PD.
Oh my gosh.
Mm-hmm.
I think you're misunderstanding what tourism is.
Nope.
Alrighty. So you said large gash wound to the chest here. Lost
This
a lot of
torso,
blood.
yeah. Yeah. She was
Alright.
having a snail trail all the way back to the end going.
Gotcha. Have blood and TXA already been started, or just the lactated ringers?
Just the LR.
Alrighty.
Alright, thank you, Doc.
No problem. Alrighty, I'm just putting you on some clotting agent here, so that should help slow your blood flow.
Okay.
Mhm.
Does that mean it's gonna stop my heart too?
No,
Am
it's
I gonna
not.
like die for a second?
Nope. It's just gonna
Damn
help
it.
your it's just gonna help your system do what it does normally, but a little bit faster. So you're not bleeding as badly from that wound on your chest there.
Oh.
Speaking of which, let's take a look at that. I know the EMS said he packed it. I'm assuming it's gonna need stitches, but let's see how bad it is. Alright, it's actually looking like it might just need some minor stitching.
That's good.
Yeah, not too bad. He had me
Hell
spooked
yeah.
when he was calling on the radio saying you passed out on him.
It's because he told me to take short, shallow breaths, so I did.
Oh, I gotcha.
Mm-hmm.
Alright, I'm just gonna clean this wound out and apply some numbing shots to the area.
Ooh.
And then from there, we'll get you stitched up.
Hell yeah. And then back to the bomb pound.
The bomb. Oh, are you a bomb?
Mm-hmm. I'm fire.
Oh, nice. I've
Yeah.
met a couple of your, I don't know if they're family members or siblings or whatnot.
Yeah, we're all brother and sister.
Gotcha.
There's a lot of us.
Mm-hmm.
I even have a twin. She's called Ive.
Oh, nice.
Yeah, she has blue hair.
Oh, I see.
Mm-hmm. Which is really awkward because I like fire, but she likes water.
Oh.
Yeah.
So you're
we're
like
gonna
kind of
throw a cup
the...
into the water.
Gotcha. So it's like twins, but also opposites.
Mm-hmm. But
That's
then
neat.
when we get together, we dress the same, and sometimes we pull pranks on the cops by dyeing our hair purple, and then they can't tell us
Oh.
apart.
Actually, I think I saw you and your twin one day at a food truck I help run sometimes.
Maybe.
Mm-hmm. It was the one down by PDM, the little Taste of Italy place.
I'll remember where I've been. I go a lot of places.
You're good. I know a lot of folks do. Like to run
Yeah.
around and such.
I just get bored if I'm stood still, and I'll be honest, if I'm standing still, I might as well be dead.
I get you. I've got a couple friends that are like that.
Can't make money if I'm just stood still, unless I'm selling weed.
Fair enough. Let's see if I can help you up here. I've got your wound all stitched up and bandaged. And with the blood and TXA in your system, you should be doing alright. But let me know if you're feeling anything uncomfortable or whatnot.
Oh, okay. I will do.
Mm-hmm.
I think I'm good.
Yeah?
Ow.
Oh.
Yeah, no, I'm good.
You sure?
Yeah.
Alright.
Alright, perfect. Thank you.
Yeah, no problem.
I promise not to burn down the hospital.
Well, I appreciate that. Thank you.
Well, you're not here at least. I can't make promises on the other times.
Well, thanks anyway.
Hey, what's good? I called about the drug addict.
Yes. Yeah, I can take a look. Hi there.
Yeah.
How can I help you?
I don't know.
Tell her when the last time you did ketamine was.
Last night?
And
Last
before
night?
that?
The night before?
And before that?
I don't know. Probably been a minute. Like
Yeah?
also from the blocks, probably. Not like a month ago.
Okay.
Maybe more.
I don't know. It's he's either depressed or like addicted to drugs. I don't.
Has anything happened in your life recently that might be having you kind of down and out?
Yeah.
Yeah?
Yeah.
I see.
Why don't
You
you tell
don't
her
have
about
to
it?
talk about it if you don't want to. That's up to you. But I'm just trying to see if there's any kind of external motivators or if there's like internal motivators. You know what I mean?
I know. I don't know what you mean.
I'm trying to figure out if maybe this is an addiction problem or if you're just trying to cope with something with what you have on hand.
Yeah, she's trying to figure out if there's something medically wrong with you or if you're just depressed.
I don't know.
You know, like you're either depressed or there's something actually wrong with you.
I mean, no, maybe there is something wrong with me.
What I can do on my end, I can do a tox screen just to see if there's excessive amounts in his system, but the thing is that's only going to tell us the right now, not necessarily if he's done an excessive amount, you know, a night ago or 2 nights ago, right?
Okay.
So if he hasn't taken Ket in the past, I'd say 2 to 3 hours, my tox screen's just going to show up negative, like he's never had it, period. So
You haven't done any Ket today, right? Any other shit?
I mean, some weed.
Okay. Yeah, nah, that doesn't do anything.
yeah. This might sound a bit harsh, and I hope it doesn't come across that way. I'm not certed for psych or things like that. I'm purely physical body doctor. But there are several doctors on our staff that are certed for that kind of thing. If you would like to have somebody he could talk to about this, I don't want to say a funk, because it's obviously something has him very deeply upset.
Right.
Let me see. I think
I know
it's
we had
only
Ember
me.
there, but she had to leave.
Yeah. Let me check and see on our staff roster, and I might give you a couple doctor names that are certed for that, okay?
Okay. All right.
Do you have something you can jot notes down with?
Yeah.
Okay. So, one that's typically around this time or a little bit later
Hey, Sam.
is a Dr. John Harper. He does psychiatry. There is also a Dr. Vivian Pagasi
Is
that does
there an
psychiatry.
EMS available to go to the 47?
Which one?
There's a Sebastian
It's gonna be on
Dior,
Mount Chiliad. It should have
Dior.
come in the past like 5 minutes.
Let's see, psychiatry.
14 minutes. 14 minutes.
There's a Hazel Hawkins. Sasha Monroe.
Appreciate it. Sorry, there's just a lot going.
And then a Souffle. And I think that's all our psychiatrists and therapists that we have on staff. They're from several different time zones, so hopefully you'll be able to find one that kind of works for you and your fella here, but and
Yeah,
I'm sorry I couldn't be of more help. I really wish I could.
No, it's all good. Do you want to run any tests? Just make sure he's not like, what if it's lupus?
Yeah, what I can do is I'll run I'll run 2 things. I'll run
Fucking
a
lupus.
tox screen and a blood panel. Lupus is a disease that can make you feel very tired a lot of the time.
Yeah.
Yeah, they're always talking about it on House.
All right, I'm going to take one syringe for the blood panel for the tox. And then one syringe for the blood test for any common diseases. All right. It'll take me a couple minutes to run it, but I'll be right back.
All good.
Hey.
Hey,
How's everything going in there?
it's going all right. Poor fella, I think his friend's really depressed.
Oh.
But he's wanting me to run talk screens and things on him just to make sure he's not kind of hurting himself in that way, you know?
Yeah, I gotcha.
Yeah, so I'm gonna go run those and then come back with the results, hopefully. Let's see. Double check my blood's not in there. Nope. I really need to figure out how to do that.
Like, it ain't just getting shot. Like, I've been shot. Like, I got caught lacking.
I know.
Hey, y'all.
Shit, I got caught fucking lacking and Yuki died. Oh. That's good, Doc.
It's all good. I just have the results here.
Yeah.
First off, we'll go with the toxicology. So if there's any kind of drugs, alcohol, whatnot in his system. He was telling the truth. It looks like he's only had a little bit of marijuana. And I'm seeing tiny, tiny amounts of ket, but that would probably be from something this small. It probably was, like you said, probably last night. So what I see on my results kind of confirms what he's been saying. As for the diseases, he certainly does not have lupus. That would have shown up on these biomarkers here and here.
Okay. All right.
Yep. I don't know if I'm seeing any other type of disease in these results either, so... Nope, definitely not.
Damn, okay.
It might just be...
Fuck, he's actually depressed. Fuck.
Yeah, he just needs a good support system around him, which you were kind enough to bring him here and be keeping watch over him, so I know he has that. The next step is likely to contact one of those doctors I told you about and see if you can schedule a therapy appointment. There is also in the MDWs, there's a place where you can try and schedule a therapy appointment or just a straight up doctor's appointment.
Okay.
So if reaching out directly to those doctors does not work, please feel free to submit an application for a therapy appointment, okay?
Right. Yeah, that sounds good.
All right. Wish I could have been of more help, but thank you for bringing him in.
Yeah, I was hoping it was lupus. All right, come
Yeah.
on, bro. I'm just gonna pull the car over. I don't have time to watch you walk.
Thank you.
Yeah, try and stay safe out there, okay? Oh, poor guy. He's so mad. He's just depressed. He's just very sad. Who the heck is that? That better not be Crash. I just put Crash to bed. What do you mean?
Doctors from DOC.
Send it.
Send it. Have you got an available doctor to come up to the prison to treat a lifer? They've been seen by EMS, but EMS said they could do a single doctor. Back to normal, right?
All right.
10-4, thank you. Just let me come onto radio channel 7. Let me know when you're here. Back to normal, transition to channel 7.
Echo 142-2352. Okay.
Dr. Shillington, 41.
Welcome aboard. 8:52, so that was nearly gonna be coming up on 2 hours and about 20 minutes. Must have just not had the moment. That's the that's the pirate I traded. Oh, that's funny. I also treated her. Who's that? Who is that? Is that Jess? She's pink. Is that Jess? Jess? That was Ellie that just clocked in. So. No, that's Viv. Viv. Probably having a therapy session.
Echo 142 seems gonna be code 4 back 10A treated on scene.
Boing, boing, boing. Goodness.
Smoking in here. Yeah, that's kind of crazy. He's a pirate guy, so. Like all the newborns in this hospital. Mm-hmm.
Hey there.
Hello. Hello.
What we got going on?
I'm hungry.
Oh, you're
Yeah.
hungry?
Yeah.
Yeah, I gotcha.
All right, sir. Feel better. Thank you. Hopefully, your friends should be here soon. Hopefully. Have a good day. How you doing?
I'm doing all right. I would ask how you doing, but it seems like you're not doing too hot.
No.
Yeah.
I was going to pick up my stupid paycheck, which
Yeah.
wasn't going to be much because Peggy doesn't pay anything.
Mm-hmm.
And this is what happens. I was walking in the bank and I just tumbled over. My tummy hurts.
We have a vending machine in the front if you want to grab like a quick snack or something to make sure you don't topple over again.
Are they cheap?
I think the cheapest thing in there is like $5, and then
I can afford that.
yeah. I'll show you where they are if you want.
Please.
Yeah.
Slow night?
Honestly, yeah, it has been so far.
That's good.
Mm-hmm. Yep. Normally, I'm up in Sandy. It was really busy here like several hours ago, so they called me down to kind of give a helping hand.
I was just up in Sandy.
Yeah?
Yeah, I got threatened by a biker gang.
Oh, I see.
They said, stop messing with Gemini Toe, or they're gonna kill me. And all the
Oh. Yeah? Yeah, just right here.
Thank
There
you.
should be food and drinks in there. I know, I survive pretty much off the crummies and the E-colas.
Be careful, I'll go straight to your hips.
I know it. Thankfully, I do a lot of walking and lifting patients, though. It tends to keep me at least a little bit trim.
That's true. Tammy must come here a lot.
Timmy,
No, Tammy. Keep you in shape, lifting her up.
honestly, I've not had the pleasure of treating her.
You're lucky.
Mm-hmm.
What's your favorite? The Mannix?
Usually I get the crummies. They're like the little dog paw shaped treats. But,
Oh, I thought that was dog food.
nope. They're peanut butter and chocolate, so dogs actually can't have them.
They love chocolate.
They might love it, but it definitely doesn't love them.
I'm gonna save one for Fish. I'm sure he's gonna love it.
Yeah, honestly, Fish is probably the only dog that would like a crummy.
Yeah, he's a little maniac.
Yep, he is.
Well, appreciate you.
Yeah, it's
so
no
much.
problem. Yep, no
You're
problem.
a hero. You're an angel.
Well, thank you. You take care, okay?
Bye-bye.
Bye-bye.
Oh my gosh, it's been a day.
Yeah?
Yeah. Just rescued 2 guys over in the canal.
Oh, wow.
Yeah. You feeling okay over there?
Oh yeah, I'm good. I fell off a billboard earlier.
Oh. Okay. That's a totally normal thing to do in the middle of the day.
Yeah, I was chasing a dog.
Oh, I see.
On a billboard.
Yeah.
I have so many questions. and I feel like if I ask him, I'm just gonna get more questions.
No? What question you got?
I'm also
How
curious.
did the dog get on the billboard?
You ran on it.
A dog ran on a billboard.
Yeah.
There wasn't actually a dog there, right?
Yeah, it was a Yorkshire Terrier.
Did okay, I believe you. My question is, because the dogs in the city are crazy. Were there like steps up to the like? My confusion comes. Oh, there was a hill. Okay, yes, that makes a lot more sense. Because I was like, somehow this dog climbed a ladder, which some dogs can do, but a terrier seems a little small.
Yeah, no, it was a hill.
Gotcha. Did you get all the scans and things done to make sure you're okay?
Yeah, I had a brain bleed and a internal bleed through my spleen.
Oh, gee. Actually, I remember
And
seeing
you're
that
on
report.
duty.
I'm light duty.
Wait, you're
I'm
changing
a
out the light
workaholic.
bulbs?
I'm a workaholic.
Oh my gosh.
It's okay. I haven't done much since then, except had like a friend die. I went to go talk to a serial killer after he had a traumatizing evening.
Oh.
Holy
But
cow!
just a light day.
Yeah, that. You haven't taken any drugs, have you?
It gave me
Tend to?
morphine, but I cried it all out.
Let me
Oh
route
my
with the
god.
I'm assuming the talk with the serial killer was at the prison.
Yeah.
Yeah.
How's y'all's day been?
Well, a little bit lighter than yours, it seems like.
Yeah, same.
Only had a potentially deranged arsonist and a couple of pirates that were drowned in canals.
Was it the same pirates that came in earlier that were drowned in the canals?
Oh, I don't know.
Was one red-haired with like dreadlocks and the other one have like a captain's hat on?
Yeah, probably. They're very nice
Yeah.
guys.
Yeah, they are very nice. I had to treat one of them earlier for a drug overdose.
Oh boy.
And it turns out that the reason he had a drug overdose was because they were trying to escape the PD, or in their words, the Port Authority.
Oh yeah.
And
yeah. Well, no, we do have a port authority over at Del Perro Pier, right?
Yep.
Yeah.
They count the entirety of officers as the Port Authority for some reason. But the
Oh, my.
captain, I think via Twinsta, the first mate said the captain quote unquote speedballed himself to get away from the Port Authority.
Wow.
And then they came in here self-transported to get medical.
Oh my gosh.
Yep. So I was wondering what those guys were up to. Good to know they drowned themselves in the canals.
I know, right?
Oh goodness. That's a little bit funny. Just a little bit.
Looks like your helicopter's right on the other side of the mountain from you.
Alright, what do you guys need me?
Use channel 6. Helicopter's on channel 6.
Yeah, I'm on 6.
Just under the lines. Straight to your right. 10-4, I can be 76 to you. Straight to your right. Further right. Good stand there. Car. Right here. Yes.
Yeah, I can't see your blips, that's the issue. Just stand by, I'm trying to work this one out.
We're not gonna be able to land it. So we're gonna have to do this the old-fashioned way.
I'm sorry, I'm just blip watching the EMS.
Oh, you're totally fine.
Yep. If you want to watch it, I think their blips are up around the Chiliad area.
Oh, God.
Yep.
Gotcha.
Hello.
Right.
You
And-
ready?
Echo 14276, San Kudo 52.
Let's go back.
So I asked some more questions like on the way here. So he's been on some various medications to try and find out the best way to treat him.
It's for EMS. Jesus. I probably should have applied for EMS, but that wasn't what kind of fit with Indy's backstory, so. That, and I think if sometimes I get
you
too
go,
stressed to
go
even do
further to your
doctor,
right, I can land here.
EMS
Just go
would
further
probably
to
be
your
a
right.
bit too stressful for me.
Oh, not that way, the other way. Sorry, I forgot you were looking at me. To your left. Yeah, go down there a little bit. I can land here. It's a little bit dark. Okay, it's literally where the car is that I'm used to landing here on. I'm not gonna be able to do it. Never mind. But you should be able to get them in. I mean, gain a little bit of height here so you can like get around that. Okay, there you go.
And we wait. She's still in Polito, or she was at the prison. That's right.
All right. Was there anyone else? Negative. Copy. All right. Lifeline 1 breaking off.
I think I have one extra space. No? Active dispatch 0. Hmm.
Echo 142, 2350.
Hmm. Oh, who posted a pic? I could go back up to Sandy, but well, honestly, I could probably switch over to a normal ticket. But I'm enjoying doing doctor stuff, even if it is a little bit slur. She might be doing a tox. I feel so bad. I can't tell. Something add eclipse now. That's what I heard. Did he say doctors from EMS?
Echo 142 is going to be 76 back to Eclipse. One patient. Doctors from EMS.
Send it.
One patient inbound. Looks like opioid overdose and a stab wound to the torso.
A-firm, has Narcan been pushed?
10 more.
Thank you very much. Doctors will be waiting.
10.
Send it.
I'm gonna take them straight into surgery.
Affirm. Dr. Fera will be waiting in surgery. Dr. Schilling, are you on radio at this time? Dr. Schilling from Dr. Fera. Mercy. Is your radio on?
Indy, do you need assistance?
I have one critical coming in that I'm going to take straight into surgery. The other one is an overdose that has already been Narcaned. Whichever one comes in first, I'll try and stabilize. However, whenever the surgery comes in, I will need to switch off to that one.
Okay, sounds good. Let me know when they get here, and I will come assist.
Affirm. Thank you.
No problem.
That my ambo. Hi there. Is this our nicked artery in the leg? Dr. Fera entering surgery. All right.
So I have her on TXA. She has 2 IVs with blood, and I wrapped the artery with a small piece of plastic wrap, plastic bandage just to keep it stable for the flight.
Yeah.
It's splintered through it, and I just need a little pressure.
All right. You've done perfectly. Thank you. If you don't mind to keep pressure on that wound while this cauterization tool gets hot. And it'll just take a couple seconds, then I can get in there and see if I can find, kind of flush it out, see where this, nick is at.
There should still be a little piece of plastic
Mm-hmm.
around it.
Yeah. Okay. If you don't mind to remove the dressings right quick, I'm going to get a clamp on this artery. Alright. Hopefully we can stop blood flow from here. I'm going to go in and see where this bleed is at, so I can cauterize. Nope, I should be good, but thank you for your good work. I can get it from here. Mm-hmm. Alright, I have this artery nick in the artery clamped. There should be no more blood coming out of there, but I do still need to work quickly because the patient has lost a lot of blood. EMS said there was 2 blood bags and TXA in her system that should assist in slowing the bleeding. I am going to get to this artery and cauterize. Wonderful. The bleed appears to have slowed. This cauterization should slow it a little bit further until I can get some sutures into the artery. My main concern is if the sutures will hold once I get them in there. If not, we will likely have to put a graft into the artery so that it can begin to heal. All right. I'm going to begin suturing the artery. Dr. Nancy, if you wouldn't mind to hold suction for me. We will start suturing up. Dr. Nancy, if you see any complications arising, please let me know. Or if the sutures seem to be going well, you can let me know that as well. All right. That's what I like to see. We're seeing an increase in heart rate and blood pressure. That is definitely a good sign. All right, let me finish up these sutures. They appear to be holding. Looking good. All right, Dr. Nancy, we're going to clean out this wound here. And then I'm going to close the muscles and the skin back over where this cut to the artery was. Actually, does it appear like it was done with a thin implement, or was this like a knife, machete, mountain lion, whatnot type of deal? Okay, it's a little bit jagged. Might have been from some kind of fall of some sort. Like more of a bit of a rip instead of a clean cut. That's fine. I can still stitch that up, hopefully with minimal scarring.
Got surgery going on here. We're using the duo room.
Alright. Got this wound closed up. Let me get some bandaging over the leg. Alright, Dr. Nancy. I don't expect the patient to necessarily wake up at this time, but if you could help me kind of adjust them on the bed, I sure would appreciate it. Perfect, Dr. Nancy, thank you. Alright, since we have that leg closed up, are there any other wounds I need to look at while I have the patient in surgery? Alright. It looks like she just has a bit of nasty bruise in here. I'll just apply some quick bruised cream to that, but that's not too bad. Let's see. Dr. Nancy, I know you like to riffle around in people's pockets. Could you happen to find this patient's state ID for me? $15,358. Thank you, Dr. Nancy. What's your opinion, Nancy? Is this going to be kind of a couple hours or overnight observation, or is this going to be a multi-day ICU? Just observation? Sounds good. All right, Dr. Nancy, I'm going to take the gurney to the observation room, and then I can hopefully let the patient sleep off her anesthesia. However long she takes to recover is all right by me. All right, that's shut. That's good.
Yeah, I just saw this wheelchair just here. Yeah, hold on, it's
What
like
the
as a
heck
bed.
are you smiling at me for?
Oh.
Alrighty. Alright. This is just a tiny bit of our non-addictive painkiller. Let's see here. Just a little bit of saline in her blood bags. Hi there, can I help you?
I was with her.
Oh, okay.
That happened. Also, emergency contact. Josh Prime.
Josh Prime?
Yeah.
Okay, yes. Would you like a rundown of kind of how the surgery went?
Sorry, what's that? Say that again?
I said, yep, you are on her emergency contacts. Would you like a rundown of how the surgery went?
Yes, please.
So basically she presented with a nick to the artery in her leg. I didn't see any debris in the wounds or anything like that. Basically the EMS brought her in, packed up really well. Already TXA'd, all that kind of stuff. All I really needed to do was go in and clamp the artery so we kind of reduced the blood flow. I then cauterized and stitched up the artery. The sutures held perfectly fine, so I don't foresee any complications.
Okay.
And then I was able to just kind of close her leg up and bandage it up really well. I believe she should just be in for observation for a little while. Nancy, if you have a more specific time on that, I'm all ears. But as far as I'm aware, her heart rate and blood pressure came up to normal levels, so I don't foresee any great
Thank God.
anything hopefully coming from this in the future.
Okay.
Yep, it might just be a sleep the anesthesia off type of deal, and then she might be just good to go. There were quite a few patients in the ER, so I'm going to quickly run and make sure nobody's critical. If she wakes up, if you wouldn't mind to come and get me so I can just give her a once-over before she leaves, I would greatly appreciate it.
Yeah, I got you.
Thank you much.
I'm giving you a warning as a friend.
On a scale of 1 to 10, how bad's your pain feeling right now?
Why did Emily just start laughing?
Are either of these criticals?
No. Well, her leg is like bent the wrong way.
Okay.
Yeah, she's currently in shock, so she's not really feeling it, but that's temporary.
Okay, can you go ahead and wiggle your fingers and your toes for me? Just to make sure we don't have any kind of spinal cord injury.
Alright. Yep, this is definitely a broken leg.
Hold on, let me try.
Let's see here.
Whoa.
See your fingers wiggling. Let's try
Whoa,
your toes.
whoa.
All right, I'm gonna start up this IV here. This is just gonna have a couple
Whoa, and you got that all for free.
painkillers, and then I'm to be completely candid with you. The way this leg looks, let me just get our mobile X-ray machine so I can tell how bad of a break it is.
All right.
Yeah, I
Kill the
wanted to put
pain,
pressure
baby.
on, but I didn't know because of how it is, how to do that. I just tried to
Yeah.
get her here as quick as I could.
Honestly, that's your best course of action. I'm not gonna lie to you. So you did the right thing. Especially if the leg
probably
is
will do that again.
splintered,
I'd be lying
putting
if I
pressure on
said
it
I
might
wouldn't.
push bone someplace where you don't want it to be. Yeah.
And I don't want to lie to you, so.
Yeah, the last thing I want
What's
to
going
do
on
is
down
make
there?
it
I think I
worse.
found something
Yeah.
in my shoes.
All right, let's take an X-ray of this leg and see what's going on.
All right. All right. Well, thanks, Doc. Thanks, Doc. I feel great.
I'm mostly looking to see if the leg is broken in multiple places. And if it is broken, period, if it's like a splinter, a fracture, or a clean break.
Oh my god. Yeah, I just need some ice packs. Hurt myself driving my car. Yeah.
Alright, according to the X-ray, it's good news. It looks like it's just one break,
it feels much
and
better.
it's a
Thank you
clean
so
one.
much. I appreciate it.
Alright.
Basically, what I can do,
Have a good one.
I will need to take you back into our surgical ward, and I don't think I would even have to put you fully under, but I will need to deaden this leg. Most definitely. Because you will need probably a pin or two put in there just to stabilize that bone, and then definitely be put in a cast for a couple days.
Okay.
Yep. Alright, give me just 1 second here. Whoop, I'm sorry. Was that patient in the other bed okay?
Yeah, he didn't call an exterminator, chase a rat off a cliff.
Oh, I see.
Yeah.
Yep. Well, that's no problem. Just so you're aware, I do have a patient that was just in surgery, that's probably going to wake up from observation here in a minute or two.
Okay.
But I don't want to let this person be on a broken leg for longer than absolutely necessary.
Yeah, no, I'll keep an eye. Unless I get a call, I'll keep an eye out here.
I appreciate it, thank you. If you don't mind to step back from the bed for me, sometimes the gurneys like to grab the wrong people. But I can get you taken back into surgery, and we'll get your leg looked at.
Alright.
Still going through surgery, a rare sight.
Oh yeah, no,
Thank
that's never
you. Is
happened
she in
before.
surgery? The doors that are supposed to be unlocked are.
Alright. Oh goodness, do we have a surgery in every room?
Hitting an ATM with a crowbar.
Yep, we do. Alright. You and I are gonna have surgery in a very fun place.
Oh, yay.
Yippee! Oh, sorry, did you need to be let back?
No,
You got it? Alright.
Yeah.
No problem. Basically what I'm gonna do, I'm gonna set you up in one of our ICU beds and sanitize it really well. And then I'll get your legs set up and all that kind of good stuff.
Yo, look. Let's see.
Alright, this is one of our ICU rooms. Basically, here's my planned method of fixing your leg up. So, right now, since you have the one clean fracture, I'm basically, what I'm going to do, would you like to be put under for this, or would you like to just kind of be sedated a little bit?
I'd rather be put under for this. I don't really want to be awake when I start feeling it.
Yeah, I don't blame you for that. That's why I always ask personal preference, because some people have a fear of being put under. But yes, I can definitely get you put under for this. Basically, my plan is to clean the skin around where your break is. make a small incision just so I can get to your bone. And I have the, have you ever had a surgery done with the Gemini bone implants before?
Yes.
Okay. Did you have any adverse reactions to them as far as you're aware?
No, not that I'm aware.
Okay. So the Gemini, basically what it does is it makes sure you don't have to come back to get pins removed. So it kind of lets you skip a step there and kind of just get back to your normal life quite a bit quicker.
Okay.
Yep, so I'll probably put some Gemini pins in. It'll probably only take 2. And I can just put one through the frontal side and one through the back side. And then your legs should be good. I can wrap it up in a cast and you should be good to go on your way.
All right, sounds good.
All right. All right, I'm going to start up our anesthesia machine right here. Would you mind to count backwards from 10 for me?
Right. 10, 9, 8, 7, 6, 5, 4.
Alrighty. Dr. Nancy, if you're with me, we'll take some of this iodine here and other cleansing agents. We will clean the skin around this leg, and then we can make our initial incision. Bless you, Skeeter. Thank you, Nancy. I will make our initial incision. 4:49 Los Santos time. Alright, yep, I've got a clean view of that break. Dr. Nancy, if you wouldn't mind to prep those 2 Gemini pins for me, I would appreciate it. Thank you, Dr. Nancy. We'll start with the back pin so we can have something steady to go on for the front. I'll align this bone up and put in the pin. How does it look to be holding, Dr. Nancy? Wonderful. That gives me good hopes for this front one. Alright, we've got our bone aligned. We'll put this pin in there. We'll check and make sure it holds. Then if it holds well, we'll close the leg back up and get them in a soft cast. Wonderful. Was that Jesse? Alright, let's close that leg wound up since things are looking good. Just do sutures to close the incision I made, and then bandage it up. Alright. Last step is to wrap it up in a cast. All right. Thank you for your service. All right, Dr. Nancy, now that this leg is wrapped up, I'm going to turn off the patient's anesthesia and move them to the observation ward. It shouldn't take long for them to wake up. Most folks take 5 to 10 minutes. But everything's looking good on my end. Awesome. Hey there, I'm gonna move him to the observation ward back here if you'd like to come with me.
Yeah, she, her.
Oh,
Sorry.
my apologies. I'm gonna move her back to the observation ward.
So, how was it?
The surgery went well. I don't foresee any complications.
Well, that's good.
Mm-hmm. Do you know the patient's name? I forgot to ask before we went into surgery.
Yeah, Keel. Keel Bone Snatcher. K-E-E-L. For the first name. Could be
Gotcha.
the only person, I believe.
Yep. Alrighty. Could I have your name, please? Just so I can give a little bit more in-depth.
Yeah, I'm Mara Winter.
Yep, you're definitely on these ECs. Would you like a little bit more in-depth explanation of the surgery?
Yeah. Yeah, if you don't mind.
Yeah, absolutely. So, the surgery went very well. As we discovered in the ER, it was a singular clean break to the leg. Myself and Dr. Nancy made the initial incision after cleaning the skin. It was, again, just the one clean break, as we saw. Hi there.
Hey.
Yeah.
Hey, Keel.
We went in with 2 Gemini bone implant pins, so Miss Bone Thatcher should not have to come back to have any pins removed. And the pins settled in well. I don't foresee any future complications. As a matter of fact, she should be good to walk out of here whenever she feels ready to.
Oh, wow. That's amazing. Wow. Thank you so much.
Yeah.
So the pins, did you say they're they like get absorbed into her body, or?
Yeah, it's
They stay in.
Yeah, do you know kind of how like dissolvable stitches work, like for sutures and things?
Yeah.
Yeah. Basically, it's a lot like that. The pin will kind of get absorbed into the bone and kind of help it grow back a little bit stronger. It has like calcium supplements and things like that in there.
Oh, okay.
Thank you for telling me that, Dr. Nancy. I was deeply distracted. But yes, I don't foresee any complications. Everything should be good.
Okay.
Mm-hmm.
Oh, how do you feel, Keel?
Oh, well.
Oh, here. Hold on to my arm. Okay. You're doing great. You're doing great.
Oh, thank you.
No, I got you. It's okay.
Yeah, no, I mean, okay, considering I just fell off a roof.
Well, I'm glad you're feeling all right. If any complications arise with your leg, please feel free to come back and see us.
All right.
Oh,
Thank you.
absolutely.
Yep.
Thank you.
Thank you.
Get you out of here.
Well, that's actually the state. You know what
Hey there.
Wait, that's not Los Santos.
No,
is not
Los
the city.
Santos is the city. San Andreas is the state.
Yeah, testing cognitive
Oh,
ability.
so you can mess with her and I can't. Okay.
Oh, exactly,
Okay.
sir.
I see how it
That's
is.
the whole point of
Second
it.
class citizen over here.
All right, and can you spell the word world backwards for me?
Even if I was like, I am fully cognitive, I can't do any of that kind of stuff because ADHD brain does not do that well.
Can you tell me?
DLROW?
Yeah, that's correct. And can you tell me what the first question that I asked you was?
What my name was.
Perfect. Okay. Well, you passed the cognitive test. 3 out of 4. That's great.
Yeah, my brain does not do spelling things backwards. It don't work that way.
It's fair. Mine doesn't either. All right.
But yet somehow I learned the alphabet backwards because I put it to the tune of the alphabet forwards and I could do it backwards.
Okay, now I gotta hear this.
No, hold on. CYXOVUTX. No, I haven't done it in so long now. Fuck. I used
don't
to
think
do
that's
it.
part of the alphabet.
No, hold on. I'm messed up now because I haven't done it in so long.
That was gonna be so cool, and you fumbled right at the.
Because you know what, Nikov, go fuck yourself.
See, now I'm
You
a
know
little
what?
bit more
I'm just
concerned that
fine.
we may have some cognitive issues.
You
if
know
she
what?
can't
You
do something
just
she was very
might.
confident about, right?
I used to be able to do it so often, and now I forgot how to do it because I haven't done it in
That's
so
cognitive
long.
decline. That's what happens in your old age.
How old are you, ma'am? You're 16.
31.
Oh, 30.
31.
Okay.
31 with ADHD. You know what?
You
Sounds
don't look
about
a
right
day
for
over
cognitive.
45, so
31 with cognitive decline with ADHD sounds about right.
yeah. All right. Well, here's your doctor for you.
Yep.
Glad you're doing
Sorry
good.
it took me a minute. I had to help someone with a broken leg. Basically, I just want you to take it very easy, especially when it comes to any heavily exertion heavy duties.
I'm an admin assistant for PD.
Mhm.
I'm gonna be going through academy, but that's not for a few weeks.
Okay,
for
yeah,
cadet.
you should
So
definitely be good by then.
I'm just doing like dust stuff. Basically like setting up events and stuff.
Yeah, I get you.
But I'm guessing like stitches in a few days will just dissolve on their own.
Yes.
Yada yada yada.
Yep. All the typical after surgery things. Do your best not to scrub at them. If you're going to take a shower, do your best to kind of cover things up so that the water doesn't help them dissolve faster. You know, all that kind of good stuff.
And if you do make a water landing, you can use your seat's cushion as a flotation device.
But yes, you should be all good to go if you feel good to go. I just wanted to give you a once over and let you know all the typical doctor rigmarole before you went anywhere.
Yeah. The perks of being an EMS back home for years, I kind of know the normal, like, yeah, don't do these something.
Yeah.
Yeah.
Does anyone want to tell me the thing that happened yesterday?
Hey, thank you. Hope you have a good rest of your day. Now,
Mhm.
they did tell you about the side
I'll tell
effects
you
of that
about it later.
anesthesia they gave you, right?
I mean, it's normal anesthesia side effects.
Right. Yeah, there's we have had some patients with some symptoms of uncontrollable giggliness for about 30 minutes after surgery. So if you do see that things are a little bit funnier than normal,
The thing with him and you know, Saints, Saying something to somebody he definitely shouldn't have.
Way of what?
Come here.
I can't know about this.
No, honestly.
Okay.
What did you get up to?
Good job, Doc.
Oh, thank you.
Oh yeah.
What's up? I know.
Nancy isn't giving you guys too much grief, is she?
That's the only thing, Doc.
All right. Well, let me know if we need to change out Nancy for Barbara. Nancy, she's gotten a little senile recently, so just making sure she's all good. See, case in point.
Nancy didn't like that one.
All right.
Not me.
Echo 142 is gonna be 76, 13 Bravo.
15358.
I would hope so.
Smack that coffee out of your hand.
Fucking do it. Just fucking do it. Okay, so she was drugged and then
Hey.
brought to the swamps, and then
You okay?
I thought I saw Jessie through the window while I was fixing someone's leg. And I prayed it wasn't her. Then I walked in here and it was. So I will be okay. I'm focusing on trying to get these reports done of the 2 surgeries I had to do. And there's about to be like 15 million cops in here that I'm going to have to help surgerize too.
13 Alpha, Code 4. Code 4, 13 Alpha.
Were you surgerying Jessie or no?
No, I didn't.
Okay. You're not writing that. Okay.
No, I'm not writing that.
Echo 142, 23, 13
Does it
Bravo.
say?
I don't know yet. I had to do 2 surgeries in a row without the opportunity to write these, so my brain's kind of fogged right now. I wish I knew,
Okay.
but I don't.
All right.
Sorry. I can tell you later.
Okay. Yeah, you tell me there. Finish up your reports.
her injuries.
Where was she before all this? What was she doing?
Last I saw her, she was here before I went on duty. I don't know if any of you guys have seen her since. It was maybe 3 hours ago.
No, I tried to call her an hour ago and she didn't answer.
Yeah, same here. Mm.
EMS from PD. EMS from PD, channel 6.
Are you able to self-transport, PD?
FM, we can do.
Thank you so much.
It's gonna be alright, Vinny. It's gonna be fine.
Fuck, I gave that other lady broken bone, and that's not right. Laceration. Tags. Broken bones. Surgery. Observation.
Yep.
I don't think I do know about that bit. So. Do you know who they were?
Is anyone hungry?
Okay.
I am.
Okay. Right, okay. Right, okay. I'm with you.
Wait, there's one other person?
Yep, I think you just got me.
Okay, I'm gonna run and make food at my truck real quick, because I don't trust anywhere right now. I will be right back.
I appreciate you, thank you.
I take a second, because I forgot I don't have a car.
You take the doctor car.
I think I know what you're talking about.
No way. Ain't no way.
Oh no, I've
Ain't
just
no
realized
way.
something that she pointed out to me. Fuck.
Over twin stuff. Ain't no way.
No.
Imagine people doing something over twin stuff.
They're children.
She pointed this out to me.
Oh, Barbara. Seems kind of like it.
What could she have said there in twin stuff? Come on. Really could have said some answer to that. That's crazy.
I gotta fucking deal with it.
Mm.
Yeah, it could be something else. We don't know. But yes, if it is that, then
That would be the dumbest thing I've
kind
ever.
of dumb.
Yeah.
Of course, I wouldn't put it past them.
Like, what could you have said, you know what I mean? Unless you were, like, directly calling out a group or whatever and call. That'd be crazy. I don't know who would do do such a thing. It's like a self-sacrifice, falling on a sword type shit.
It seems like a lot of us phoned her just by chance without knowing she was missing.
Yeah.
Didn't.
Saw her.
Hmm.
I knew I should have tracked her.
Yeah, Clark phoned me trying to see if I had her tracking, and I realized she's probably the only person I don't have on tracking. So if she didn't have her phone, Veronica said she didn't have a phone, so she wouldn't track anyway.
True.
What does she have on her? Nothing?
I mean, Veronica said she didn't have a phone or anything, which makes me think they took anything, maybe.
100%. Her phone's gone.
Yeah, could you run her, Marcus?
Yeah, I'm guessing PD've already done that anyway, but I think they probably have done it.
I really hope they did.
I mean, Veronica's good at her job, so I can't imagine she wouldn't.
Let me one time go on.
I got 142, 76 back to Eclipse, one patient, doctors from EMF.
Narcan.
Send it.
One patient inbound has been hit in the head with a police baton. Some bleeding, wants to get checked out.
Hey, firm, doctors will be waiting.
10.
You should, yeah, you can speak.
Alright.
Oh wait, no, it's 2 on duty. I think one of that guy was shot.
Okay.
Can you
I
let me
can
be
get
or
him.
no?
I can get him.
Yeah, I was just driving by and I saw him laying outside of his car. I think he might have gotten an accident.
Alrighty, what am I seeing here?
I go 142, 23 Eclipse, one patient.
Yeah.
Hello, sir, are you with me?
Oh yeah.
Hi there. What happened?
Call me Neasy.
Run over. Got like
Got run
a
over?
red car or some shit.
Okay.
Some boy got taken or something. I don't know.
Okay.
But just kind of like blacked out.
Gotcha. Alright, let's see here.
Hell yeah.
Am I seeing anything that
Thanks, dog.
is any cause for concern that might need a surgery? Any broken bones? anything more than some heavy bruising and things that ice packs could take care of.
I'm still a little dizzy.
Oh, I fell into the purgatory.
Brother.
Oh, my head.
Your
My
head?
beautiful head.
Alright, let me take a look.
Oh, thank you.
Fish, are you okay?
Let's take a look at this head here.
Hell yeah.
That sounds about right for today. That sounds about right for today.
That sounds about right.
Come on, brother, give me something. What am I supposed to be doing?
Alright,
Hey,
one
Doc.
patient, he was brought on the scene
I'll
to,
beat
with
the
a,
fuck out of a cop.
he got hit in the head with
Let's
a police
see.
baton. His eyes were looking good, but just wanted to
Hey, look, there he is. Hey,
check up.
Baldy. Hello, sir.
But he was given some ice
how's
I'm just gonna readjust you in the bed here. If you're not feeling up
Good.
to moving, you're welcome
Wish it
to
was
lay
broken.
back down.
Oh my god.
I still do want to take a look at that head of yours, but I can't quite see what's going on.
Yeah, we can do that.
Alright, thanks, Doc.
That's the only person, though. I haven't seen anyone else.
I'm just gonna cuff you to the bed, okay, sir?
Mm-hmm.
Tighten that up for you. Here we go.
Buddy.
Well, I mean.
Alright, let me see what I can see on this head here. What's going on?
You said you got 2 knocked down?
I got one.
Give me something, buddy.
Yes, I got you some ice packs on them bruises and everything. I feel a little bit of discomfort, but it'll help calm it down, okay? 1 second.
I don't think I'll live.
Echo 142 is going 42. Have
See, I
the rest
just
of your
nailed
day,
that last
guys.
Sorry, say again?
Happy Thanksgiving.
Oh, ice pack. My head's very,
Gotcha, okay.
very hot. It's very hot outside.
Mm-hmm. Alright, that should have you an ice pack there.
Oh no, my head.
Mm-hmm. Is there any kind of lacerations,
Actually,
bruising?
It says I'm fine. It might just be like. It might just be a bit. I think it might be because I'm sitting down.
Maybe?
Let's try this. Yeah, I feel better.
Yeah?
Yeah. Alrighty. Thank you.
Yeah, it's no problem. I'm glad you're feeling a bit better.
So do I.
This is God.
Try now.
Oh. There you go. Oh, there we go. Okay.
You can walk,
sir. It's a miracle.
You need to get one of those things that old people get where they sit on lounge and put feet on the pad that vibrate and go like.
Fuck.
What is it?
I said something stupid and I'm embarrassed to go back over that.
Oh, I see.
I don't want to go back. I'm scared they're going to judge me even more.
They will probably judge you, yes, absolutely.
Already are?
Yep. You probably made it worse when you walked away, I'm not gonna lie.
Oh, absolutely.
Yeah. Was it something
They said
about Jess?
No, they said Barb was 47. I said menstruating instead of menopause.
Yeah, that's rough, buddy.
Yeah, it's pretty not good, huh?
Yeah, that's a little bit awkward, I ain't gonna lie to you.
Yeah, I kind of want to die right now, honestly.
That's a little bit of a rough one, Big G.
You ever wanted to, like, fold into a million pieces and disappear?
Oh yeah, 100% all the
Yeah.
time, yeah.
That's like right now.
Yep. Don't blame you. I believe in you, Big G.
Oh, thank you. Come return.
Oh, what do we do now?
Thanks, Bob. Appreciate you. Sorry about what I said.
Get it together.
Sorry. Locked in.
Sure. Okay.
Don't call me buddy. I feel like I'm scared of where this is going. Anyway, okay. Do. Mm. Hey, just come here real quick.
He can be a little. I'll be back.
Okay.
Indy, do you want to come over here?
I read the report. Does she need any IVs changed or anything at this time? Because I'm probably about to go 42.
I mean, I'm not on doing anything.
Alright, Barb, I appreciate that. I was just gonna check before I went.
Food's in the fridge in the break room.
Thank you. You are a gem. Thank you a million.
Yeah, no worries. I don't trust trucks or anywhere right now unless I make it myself, so.
No, I'm with you on that one. Alright. I hate to be that person, but I've been on for long enough. I am cooked enough. I probably need to go 42, so.
Ah, you're perfect. Have
Yep.
a good night and happy Thanksgiving.
Thanks. You too.
It's that time for you.
It is. Dr. Fera, 1042. Good night, everybody, and happy Thanksgiving.
Copy. I'm not kissing Pug. Do you know what happened to Fish? He's like wrong.
I have to quit so I can go back into the normal queue, but that should not take long. Joey.
See if they're through and through and where they're located.
Do any of y'all need any food, drink, whatever? Because I can run and go get something and bring it back.
No, thank you, Indy.
I'll be going to bed in a minute.
I'm good.
Thanks, Indy.
Okay. If y'all need anything, just call me, okay?
Mm.
Okay, your shoulder's gonna be numb. You're gonna feel a little bit of pressure. Okay, I just need you to be patient there.
Hey, fish.
I don't know. I didn't get a good look.
No.
Hey.
Hey, where do you go?
Santi's up in Sandy. I was just gonna go, catch him up on what's apparently gone on since I didn't see him at the hospital.
Yeah.
Do you want details on the report?
Yeah.
Okay.
Good.
I'll basically give you the TLDR for right now because I'm trying to drive and talk at the same time, but,
Yeah, that's fine.
as far as I can tell, the wound was jagged on the top, smooth on the bottom, which means it was likely done with one of the knives you can buy from ammunition. It nicked an
Where was
artery.
it?
In her torso, I believe.
Okay.
Don't quote me on that, though. I would have to look at the report again. But the stab, I don't know if it was one stab or multiple. I can't remember from the report, but, Actually, can I call you back, and when I tell Santi, I'll just tell you at the same time and just read the report to you, because I don't want to give you any false information.
Yes, that's fine.
Alright, I'll call you back in a minute.
Okay, bring Santi over here if you can.
I will. Or I'll do my best, in any case.
Yeah.
Alright, bye.
Okay, bye.
Hey. Sorry it took me a minute.
No, you're fine.
I promised Silver I would call her and just read the report to her. So, are you okay with me doing that, and I'll just read it to you at the same time?
Yeah, no problem at all.
Alright.
Hello?
It's Indy.
Yeah. No, it's you.
Yeah. Let me pull up the report right quick. Alright, I'm just gonna read it off pretty much word for word.
Okay. You Santi?
Yeah, I'm with Santi.
Okay.
So, the report says 1 stab wound to the torso, jagged on top, smooth on the bottom. Severed artery, nicked kidney, damaged abdominal wall. Major blood loss, which is kind of obvious from the stab wound, and the big important thing here is a drug overdose. It says patient was brought in via EMS. Prior to being brought in, the patient was administered Narcan. Patient was given a blood bag, fluids, and the wound was packed by Dr. Nancy. Upon arrival, patient was pale and profusely bleeding from the torso. The source of the bleed was clamped to help staunch it. The patient then went blue. Patient was resuscitated and given an additional blood bag. The patient was then taken into surgery. Upon inspection, it was determined that the patient had a severed artery and nicked kidney, causing major arterial bleeding. Artery was repaired and unclamped. Kidney was repaired. Abdominal wall was repaired. Skin was cleaned and stitched. Patient was moved into observation. Patient's labs were drawn and came back showing foreign substances present.
Barb, just checked her again. It was fentanyl.
It was fent? Okay.
Mm-hmm.
Okay, yeah, I see that. Test shows she had high concentration of fentanyl in her system.
Mm-hmm.
Okay.
Who would have fentanyl like that?
Any gang.
Sure, any gang would.
Any gang would have fent.
Like what? The only gang we know of. It's the stupidest reason I've ever heard in my life. And
This, you have to remember, is the same gang that shot a doctor for saying someone might be somebody in a car. Shot her in the head, Silver.
with Jessie, she literally tweeted out like some 2 words, bro, and it wasn't even related. They just think it is because they think they're the main characters or something. The
Yeah,
world
they
doesn't
do.
revolve around them.
They do.
So stupid.
Nobody in that cut is worth spitting on if they're on fire.
Yeah.
So, this
That's
is
why they
gonna
have their own
sound...
apparently their own hospital over there.
This
know
is gonna
nobody
sound
wants-
crass. This is gonna sound rude, and that's because I intend it to be. They're all pieces of shit if they think a singular post, a singular comment is enough to start a war over.
Yeah,
And it's
like
not a
them
war
missing.
with another violent
Or-
gang, it is a war with doctors.
It's just literally stupid.
It is
It
stupid.
makes no sense to me. It's like
I
they're
know.
oh my god, that's not a cult. They act like they're a cult, bro. Cults would.
I
It's like
know.
this- oh my god, it's so stupid.
If I could give you an explanation, I would be the most renowned psychologist Los Santos has ever seen. But
So
I
true,
can't.
bestie. So dumb.
Because
It's like now I'm just gonna look up a post and be like, yeah, I don't like that, so I'm gonna go stab them. Yeah, that's literally what they did.
I know.
I don't like what that this girl named Gemma, I don't know, said 28 days. Yeah, I don't like that number. I'm gonna go stab her.
I know.
I don't like it, guys. What?
I know.
Like-
I know it's bullshit. You know it's bullshit. All of us know
So
it's
dumb.
bullshit.
He said something like, oh, you know, F that gang or whatever. Like, yes, yeah. But she wasn't even about them. The world doesn't revolve around fucking freaky people that think they're in a cult, bro. Like, what the? My god, it's like the stupidest thing I've ever heard. It's so dumb. Oh my god. Just ranting, sorry.
It's okay.
I hate being here because I hate the freaking hospital.
Yeah.
Bro. Oh my. Oh, I don't know what we're gonna do. I don't know what they're gonna do. So
I don't know.
guess we'll go freaking stab people. They said they don't like my favorite color. I don't know, bro.
It'd be nice if we had as little sense as they do, wouldn't it?
Sometimes I just if they want to do that, then I go lower. I don't give a shit.
You can't go lower than the hell they've placed themselves in, Silver.
That's so true. But I can be as petty.
I know you can. But the fact of the matter is, why would you want to stoop to the level of a bunch of whiny gangbangers?
Just to show them the world doesn't revolve around them. Honestly.
You want to kind of know the way to do that, though? Treat them
Not
like the
to.
babies they are. The ones that have to fix all their little emotional problems by sticking a knife in someone.
If it was like over something like with sense, I would be like, all right, I guess. But this is literally
I know.
bullshit. It's so.
I know.
Oh my god. It's so funny.
I hate to say I have to let you go, but I have to run this radio that I still have back to my locker at Sandy Medical.
Yeah, you're good.
Alright. Do your best to stay safe if you need to take breaks at the hospital. Go outside, get some air, you know. Do what you gotta do to take care of Silver so we can take care of Jessie later, okay?
Yeah, I got you. Thanks.
Alright.
Bye, bestie.
Bye. So anyway, hi, handsome. Good morning.
Hey. Okay. Yeah. Yeah.
Yeah. When I left, Jess, Geo, Vinny, and Silver were all with her. She was still in observation. It's entirely possible she might end up in the ICU, or she might wake up and be on a warpath today. Who knows?
I didn't go down there when I got the text because half of me is thinking, why the fuck did you do it? And the other half is, God damn it, my friend got stabbed.
Mm-hmm.
And as much as she annoys me and as much as she gets under my skin, she's still my friend.
I know. If you want to stop in and see her, we can both go if you like, if that would make it easier. The part that pisses me off is the drug overdose.
Yeah, that, yeah.
So they had to drug her. To stab her.
You said it perfectly to Silva.
Which part? I said a lot to Silver.
You said a lot to Silva, and probably every single pot you said to her about them.
Not worth spitting on.
Who it was.
Yeah, it's blatant. Also, Jesse's phone is missing. So they took that from her.
That's great.
Mm-hmm. So, hey, Rabbit.
Hey there.
Thank you. That was a blessing. Appreciate it. Even if your feet are stinky. So... I don't know what all gets said on her phone. They removed her from the doctor group chat so that they wouldn't have access to any further privileged information.
Yeah, probably very smart.
In any case, not good.
No, it is not. I'm trying to think. I don't think there's anything we really need to move her from. Nothing's really said in PDM or anything like that.
Yeah. I didn't know if there was any, Oni stuff that might need to be taken care of.
Nothing like a group chat, but I don't know what she's texted individual people.
Yeah. Hopefully she was smart enough to not leave a paper trail.
Hopefully she was smart enough to add a password to her phone.
Speaking of which, I need to do that. Just in case.
Yeah, I guess you do. With these cowardly motherfuckers.
Yep. Alright. Security code saved.
That's just great that we have to do that.
Mm-hmm. Lovely, isn't it?
Let me, at the very least, text Geo.
Yeah. There is an officer that's, investigating, thankfully. Or maybe not thankfully. I don't know.
I mean, they attacked a doctor. I don't think there's anything bad about them investigating it.
Yeah.
I don't think Jesse's dumb enough to send anything bad if they look through her phone.
Mm-hmm. Mm.
What's up?
I just don't like it.
No. I don't like it either.
The problem isn't going to be figuring out the gang that did it. We all know the gang that did it. It's who in that gang they can charge with it. All
Yeah,
signs point to the same person that shot Viv. Which everybody assumes is Jim and Knight, but there's no proof.
You know, if you're gonna go into a hospital and shoot the person, it's pretty fucking funny that you decide at that point to have some common sense and wear a mask.
Mm-hmm. Yeah. It's great.
Are you okay? I know you asked me earlier.
I'm physically okay. I mentally am exhausted and frustrated. Because there was a massive influx of people to the hospital. And when Jesse got brought in, I was in surgery with someone who had an artery torn in their leg. I fixed them, left, and then immediately had to go into another surgery, but all the surgery wards were full. So I took the person into an ICU room because it was just a basic broken leg. They were conscious enough that I was able to get consent for treatment, all that kind of stuff. And what makes me just a little bit sick inside is the fact that as I was treating this patient's broken leg, I saw out of the corner of my eye just a flash of pink hair being carried by a doctor. And I thought to myself, was that Jesse? But I had a patient open on the table. I couldn't leave. Of course. Not that I would have any, but you get what I mean. I couldn't run out and check. So I finished up my surgery. I take the person back to the observation ward because they just need to sleep off the anesthesia. So I ask the person that brought them in what the person's name is. And they say, oh, this is Keel Bone Snatcher. So I look up the MDW profile. Osiris MC. Right there. Like the third tag. So I'm waking up an Osiris MC member from anesthesia while Jesse is 2 beds down, unconscious, and surrounded by our friends and family. So, there was a very real part of me that wanted to take the pillow out from under that person's face and smother them to death in front of everybody. But, unfortunately, I have the sense of a normal human being. And I can't just go around stabbing and killing people like the fucking animals in Polito.
That is the price you pay of being a normal fucking person.
Isn't it, though?
Unfortunately, those monsters are seen as people by us.
What a shame. I know it's not a rational thought, but there's a small part of me that halfway hopes that they do in some way come for me, so maybe I can bite one of their fucking fingers off or something. I'm so mad, Santi. I'm so mad I'm cold.
I understand how you feel. Not to the extent of how you feel, obviously, but it's a very rocky road to go down.
I know.
Those fucking idiots don't deserve anything, honestly.
No, they
And
don't.
I hope that, you know, they get their karma back at them, but I know how you feel about everything. I know when we've had our conversations about no matter what happens, you're still gonna work on people because you told me that you, your biggest thing is helping people.
Yeah.
I know you're angry, they're beautiful, but I don't want you to get hurt at all.
I know. And logically, I know I don't want to be hurt either. And the likelihood that it would be some kind of one-on-one fight is laughable. There's no way. They probably rolled up 4 deep just for her. Wouldn't surprise me.
They probably fucking did. I mean, they ran into a hospital with a gun and just shot someone. I don't think they're, you know, have their lines that they don't cross.
Yep.
Congratulations, you found a doctor. Let's all pull out guns and just make sure she doesn't try anything.
Mm-hmm. Oh god, Rin's not awake.
I think if you want me to be completely honest with you, Ren's gonna hate herself for not being awake right now, but I think it's for the best. Because I wouldn't put it past her to go somewhere right now, considering she would know exactly where one of them is.
Yep.
I just hope when she does find out, at least a few of us are there.
God, I hope so. I'm tempted to send her a text to say, please wait and let me tell you about the report or something like that. Not even to stop her, but maybe just to... I don't know. Pause it long enough.
It wouldn't hurt. Just a simple, before you do anything, please talk to me.
I wrote, I'm sure you've gotten the ICU text. When you wake up, please reach out. I have the report, and I have the report and can tell you everything I know. So if you are going to do something, you at least won't be doing it blind.
I think that's good.
Let's see. So if you're going to do something, at least you're not doing it without all the available info. Might be better.
Yeah. My only concern is, well, I mean, no, that wouldn't even be a concern. That's her wife, so she would be privy
Yeah.
to all the information.
She is.
Yeah, okay. I know you're not dumb. I'm just worried.
No, it's okay. That's the only reason I told Silver anything, is because she's on Jesse's ECs. That's why I told you, because you're on Jesse's ECs. Well, I mean, I've told you a lot of stuff anyway, but I mean, this one was legally.
Yeah.
Yeah.
Do you need anything?
I don't know. I am not gonna lie. Part of me kind of expected things to blow over before she got hurt. And when I saw her, my heart just dropped to my feet. So I'm still kind of recovering from that initial kind of panic, I guess.
Yeah. The shock of the whole situation.
Mm-hmm.
Take all the time you need.
Yeah.
I'm not going anywhere.
If I look back on it, now that I'm a little bit calmer, it was probably a very good thing that it was not me that operated on her. Not because I couldn't do it, but because something would have been nagging me in the back of my mind that entire time. Just the fact of, I know this person, I know this person, I know this person. So, as much as I hate that I helped an Osiris member to their feet, that was probably the better course of action that today could have taken. And I'm going to keep helping Osiris members to their feet, because it's my job. Just today, I want to bite everybody in that cut's head off.
Yeah, I understand the feeling.
Mm-hmm.
And there is nothing wrong with being angry right now. I think your feelings are valid completely. But I'm also happy that you understand, you do have your values, unfortunately.
Unfortunately, Mr. Palermo, You are dating a oddly level-headed Alabamian woman. So you probably won't see me snap and stab nobody anytime soon. Swing on one, maybe, occasionally. Especially that one local that talks about, like, periods and stuff like that. I hate that guy.
Yeah. He deserves it, though. And, you know, you say unfortunately, I say thank God I don't have to worry every single day about her snapping and doing something dumb. All I have to worry about is sitting here and learning new things every day because she's so passionate about what she does. And honestly, I think I got the better deal on that.
You are a flirtatious dork, Santi.
You say flirt, I say words I genuinely mean.
How did fishing go, by the way? Go good?
Yeah, it went fine. I managed to
Yeah.
get half a cooler before I got the text, so I kind of just came back over here, sat out the lobby staring at it,
Mm-hmm.
and then I got the text from you.
Yep. It still says she's listed as observation. If that hasn't changed to ICU by now, that likely means Jessie will wake up sometime tomorrow. Because Dr. Nancy would have switched her to full ICU if she was going to stay any longer than one night, so.
Yeah. I got a text from Gio that he's in the ICU, but I don't know if he knows the difference.
A lot of people don't if you're not a doctor.
Yeah.
Basically, what that means is they're just going to monitor her overnight if she's in observation. And if she wakes up tomorrow and is cognizant and aware enough to leave, she will be allowed to leave. She'll probably be on light duty and told to take it easy for several days. I don't know if she'll listen, but that's probably what she'll be told to do.
I don't think that girl could take it easy if she had both her legs and arms broken. I think she'd manage to somehow fucking grab her little 4-cell sign she throws down, use that as a crutch to just try and sell a house.
Yeah. Oh god, can you imagine Jessie in a wheelchair?
Oh god.
The thought terrifies me.
She already tries to hit us with a car. Imagine what she's gonna do with that.
God, that woman. I hate her, but I love her. But she annoys the fire out of me, but she's a good mentor and a good teacher. God damn it.
She somehow... There's like a... I like this person. I hate this person. This person's alright. She hits every single category somehow.
Mm-hmm.
I didn't think it would be possible.
But it is.
Yep.
Ain't it crazy?
specific pot.
I think my vote is for all at this point.
Yeah, I think that's a good vote to put it on.
Me. Did Gio or Vinny either one try and call you down to the hospital?
No. Last
Okay.
person I got in contact with was Gio.
Alright.
That conversation was just me saying, "Is she okay?" "Nah, she's in ICU," and I said, "God damn it." Nothing really past that.
Alright. That reminds me, actually.
What's up?
I needed to remove Silver from the ability to track me. As much as I love Silver, I don't trust that she would keep quiet about our place.
Yeah. If I'm completely honest with you, I do want other people to have some eyes on you, but currently I think not even I don't trust Silva. It's just the fact that I think she just let it slip.
Yep. Well,
I
I
could-
still have, you tracking me, and I kept Cass.
Yeah, that's actually who I was about to suggest.
Mm-hmm. Because Cass already knows.
Yeah. It would have been very funny to try and get out of that situation without telling her.
If anybody has asked why I bought a camper, I said, I just wanted the storage for all my fishing stuff, and I was getting tired of living in the city.
Yeah, not a bad reason.
Yep. Actually, I don't think anybody has asked me yet, but that's the excuse I have prepared in my head.
Unless someone goes snooping around your profile, I don't think anyone's gonna ask.
True. If anybody's gonna
Ironically,
ask, it's gonna be...
It's Jesse.
It's gonna be Boss, Rin, or Skyla. Because Skyla's on her MDW all the time.
She is an information goblin.
She is. And she's gonna be like, Indy, when did you get a camper? And I'm gonna be like, well, I bought it the other day. She's gonna be like, why? I'm gonna be like, Skyla, I'm from Alabama. I don't like living in the city. Where's it at?
Maybe.
In Sandy somewhere. Actually, I might even say over close to Chumash. I just lead them the entirely wrong direction.
Maybe I'll keep my apartment and just, if we ever need to stay in the city, or if they ask, where do you stay, Santi? Oh, here.
Yeah.
Yeah.
Or if we're ever too tired to drive up one night, just crash at your place.
Exactly.
Fair enough. You know, the Irvine Inn up here does have rooms. I don't know if it's more expensive than Infinity Apartments, though. Probably. Considering it's a privately owned place.
Maybe, I'm not too sure.
Yeah.
I mean, the apartment would be more for show anyways. I'm content being here.
Yeah. It is nice to not hear police chases going through at all hours of the night.
Oh.
I think I've slept better out here the past 2 nights than I have ever in that freaking apartment.
The amount of people who just don't know what their room is, and I just hear my door jiggling.
Mm-hmm. I believe it. Actually, for scientific purposes, there is one thing I want to check.
Mm-hmm.
I'm curious if you can actually change clothes in the camper.
Ooh. Actually, yeah, that's a good point.
Hang on, let me let all the drawers and things settle. Now that I think about it. It's okay if not, because there's literally a clothing store, like, that way.
Yeah.
But it would be a nice convenience.
I mean, if we can, I need to throw a pair of pajamas in here.
Yeah, that's what I was thinking. I'm not thinking so.
Maybe not.
Yeah.
I mean,
It's
if
okay.
anything, we could always stop at this clothing store on the way here.
True, we could, if we wanted to be in our jammies.
True.
God, that deer is loud. Did you hear it?
Oh, yeah.
Yeah, it screeched.
Look at them. Just having the time of their lives.
Yep. I locked it back up since, it seemed to be having a little bit of trouble getting the bed and things, all settled in.
It's taking its time. It's okay.
Yeah.
That's probably just gonna be a later thing, if anything.
True. I mean, all our stuff's in there, so even if we can't... If you pick up what I'm putting down, yeah.
Yeah.
Oh, that one had antlers.
Yeah.
Yeah?
The doe and the deer. Or doe and a stag, technically, I guess.
Yeah. You know that meme for a while that was like, would you still love me if I was a worm?
Mm-hmm.
Would you still love me if I was a loud-ass deer?
Oh, 100% them. Indy,
Yeah.
I'd love you if you were a loud ass deer.
I really need to yoink a camera from one of the SAMA facilities at some point.
Can you just straight up buy them?
Yeah, I can.
Probably not a bad idea.
That way I can take pictures. Especially of the rabbits. I know Cass would love to see the rabbits.
Oh yeah, that reminds me, we need to get a Cass down here one of these days.
Mm-hmm. Oh, I have 2 things I need to tell you. First of which, I meant to tell you yesterday, but I forgot. While Vinny was taking me to get my truck out of impound, he was like, if Santi wasn't my best friend, I'd clock him one. And I was like, for what? And he was like, well, he's a courting you, isn't he? Like, y'all have been on a date or whatever. And I lied to his face.
Oh, what?
And
What
I
did he say?
said, Joey, we just went hiking. As friends.
Oh, how'd he take?
He went, oh. Well, all right then.
I might have told him that was a date. So if he thinks
I
really
don't
hope-
think it's a date. Oh no.
Oh, it's gonna be so great. That's gonna be so.
Oh no.
Hey, you remember when we first got together?
Yeah.
And I said maybe I should start acting sad.
Oh goodness.
I'm not saying I should start doing that, but it's really funny that it's kind of panning out that way.
Oh no. I didn't know you had called it a date to him.
I think I let it slip like once.
Oh, I see.
That's probably why he had that reaction.
Yeah, so now I've told Boss straight up we're not dating, and I've now told Vinny straight up we're not dating. So the reactions when they figure out we eventually are actually dating, I'm probably just gonna have to be like, teehee, yeah, I lied.
Teehee, sorry.
Teehee, sorry, it wasn't your business at the time. And also, every time we were doing something that seemed like a date, y'all kept yoinking Santi away from me, so... And that was when we were actually not dating, and we're doing stuff for the food truck.
Actually, every 10 minutes, I hated it.
Mm-hmm.
Because you know what? I think at one point, I had to be just straight up with the boss at the beach.
Yeah.
She asked me, what, am I stealing your thunder? I was like, yeah, kinda. I just had to just straight up say it. Because that's
Yeah,
when she went
kind
silent
of.
and then drove away.
Oh my god, miracles happen? Jesse reading a room? Oh,
Yeah, I know,
well,
right?
actually, it wasn't even reading a room. You told her straight up, so I guess I shouldn't be surprised.
God.
God, did you know Jesse told me one time? I don't know I can't remember if I've told you this or not. It was a long while ago, like probably a month ago at this point. And I've told you I told her at one point that like I had feelings for you, like I was kind of crushing on you a bit, but I wasn't going to pursue it if you weren't interested. Because that was like right when I first started my residency and stuff. And at one point I think I told you, like, she took me on this long ride and she was talking about stuff, like she was feeling stuff out and beating around the bush. Blah, 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 blah. And I don't remember what led up to it. But at one point she was like, yeah, if I didn't approve of you for Santi, you wouldn't be around him.
My ass.
And then she was also like, the protections of what we offer extend to you now whether you like it or not. And I was kind of gobsmacked because you were standing by your habanero and I was just far enough away whispering that you probably couldn't tell what I was saying. But I was like, damn, Jesse. One, that's a grown-ass man. Two,
Yep.
What do you mean? Whether I like it or not.
I want to see the universe where she tried and tell me, yeah, you can't hang around with her anymore. I really want to now.
Yeah?
Listen, I'm a pretty level-headed person, but I don't like that.
Mm-hmm. Well.
Especially since, I obviously had a fat crush on you too.
Oh, yeah. Well, I think nowadays there's a few more steps that would be involved before she could be like, hey, Indy, no, you and Santi can't be together. Because I, number one, would be like, excuse the fuck out of me, ma'am. The hell you mean? You would be doing the same thing. And there's also, the third family member, or whatever you want to call it, of us being in the same group now. At least by technicality. there would be a lot more webs to unweave than there was about a month ago. So if she wanted to get rid of me, she should have done it already. That's all I'm saying.
Very true.
Mm-hmm. That actually wasn't the second thing I wanted to tell you. I just got distracted because I remembered. What the hell was that?
That was a rat loader.
Oh. That thing
Yeah.
was schmoving. What the heck?
Yeah, if you drive your tires on the tracks at just the right angle, you go fast.
Oh. That explains why I jumped that rock. Okay. Anyway. The second thing was I was thinking of getting a lot of the PDM folks some Christmas presents.
Ooh.
I don't want to spend like a ton on it, but I also want it to be thoughtful. Like I was thinking the plans I have, because I've jotted some down. I would like to get Skyla a Sunny the dog plushie. They sell those at the FIB. And as for Cass, if any place sells a rabbit plushie of any sort, I was gonna see if I could get one of those. But that's the thing, for everybody else, I don't really know what they would like.
You know what? Joey a baseball. You'd like that?
A baseball?
Mm-hmm. And just, you know, sign your name on it. Give a little message on it. Baseball is a big part of his life, and I think that would show that you listen to him. And he very much appreciates that.
Fair enough. Let's see. I did have a thought for Rin, but I don't know if what I would like to get her exists. She loves cars and nerding out about cars, and I didn't know if there were any, like, model cars of, like, a little Futo or something like that. Because I know typically when she's driving around, she's in her Futo. I think it's her favorite of her cars. Otherwise, she wouldn't drive it as much as she does.
That's true. I don't know, actually.
I don't know either. Because it kind of tickled me the other day when Jasper and Jasper and dear Lord, I can think of his name, I promise, Jules, were like, oh, Santa Claus.
Yeah. I actually am going to do something with that, by the way.
Mm-hmm.
Yeah, I'm dressing up. I'm going to wear a white wig, get a white beard or something, maybe. Maybe I'll just... No. Maybe.
Yeah?
Yeah, maybe they got like a Santa Claus costume in the clothing store. Wear a wig.
I'm sure they do. I don't know. The thing is, if I get something for a couple people, I need to get them for everybody. But I don't know what everybody likes. So that, therein is my struggle.
We got plenty of time to think about it.
True. I did see an advertisement earlier for, like, custom gifts to be made through a company that's run by Dr. Hayabusa.
Ooh.
So if a Futo model doesn't exist, I might try and see if I can commission it, because, I mean, that's my ma. So
That's true.
what I might do, if I can't get enough stuff to give something to everybody, I'll probably just secretly squirrel them away and then hand them out at a time other than Christmas.
It's. I mean, to be fair, no one has to know you gave certain people gifts.
I know.
And while you may feel bad about it, certain people do make actions that, you know, make them stick out.
True. I just looked over to the camper and all I saw was no mass.
You know, it's funny that that's the first thing you notice when mine was the flamingo up there.
Yeah.
Yeah. Now I just am.
Yep. Ass.
Yeah, just like that.
Yep. And there's deer ass over there, rabbit ass over there, hot ass right
It's a lot
here.
of ass around here.
Anyway.
Smooth.
Thank you. I actually, I do need to run to Sandy Medical because I have a government radio on my person.
Yeah, I'll just tag along with you.
Dear God, I hate myself. I want to die.
What happened?
Did you not see me elbow in my own window?
Oh, no.
Wow.
Maybe I'll just do distracted by the ass over there.
Yep, the deer ass. I know, I can tell.
Sure.
That's quite a mobile rock.
That is a very mobile rock.
Mm-hmm. Also, this truck can freaking fly through the Tongva Hills.
You know, I might know that already.
Oh, I'm sure you do. But I was genuinely surprised.
So you know how sometimes I do some dumb stuff?
I'm listening. And yes,
I
I'm
might have
aware.
climbed halfway up through Chiliad just to see if it could.
4-wheel drive, baby.
4-wheel drive.
This might be a little bit cringe, but are you looking at specific email chains right now?
Why, hold on.
Please just take a look so I'm not wheezing by myself.
Oh my god.
Yeah. We have so many degenerates. I'll be right back. I'm just gonna run this into the safe storage.
Yeah, you're all good.
While we're right here, I'm gonna swing in and grab my paycheck.
Oh yeah, I should grab mine too. Probably gonna be like $200. I haven't really done much.
Gasp. Not defrauding the government, Mr. Palermo? Do you remember when Jesse said... Were you around when Jesse said that to Cass?
Yep.
Yep. Okay, making sure.
Cass is just too innocent to know what she means.
To be fair, I only think I know what she means. I'm not certain, though.
Oh my god, I've been defrauding the government apparently.
Gasp. 2 days, that's not bad.
1,471.
Wow.
That was a few days though.
Yeah.
You know, I wouldn't mind. I know it's not probably not going to get as much traffic as we want, but I wouldn't mind a place up in Sandy for seize a day every now and then.
Yeah. Well, I mean, it'll be a food truck. We can always come up here.
Yeah, exactly.
I mean, heck, we could park it down by the water and do fresh caught Fridays or something like that, you know?
You are a genius.
Like, literally fish up the fish.
No, beautiful, I have a good idea.
Yeah, what's that?
Fish your own fish. Get half off.
That is too funny. I mean, hey, I'm down for it.
I want to have as much fun with this business as possible. I don't even care about making all the money in the world.
Yep, so long as we have enough to pay for the gas for the food truck and, like, to keep it going, I will be content.
Oh, yeah.
Actually, I had a thought, and the safest time to do it is right now. I was going to show you the house Boss wants to buy.
Ooh.
So
Okay.
you'll know where it's at. It's right around here. This one on our right is the one she wants.
Oh my god.
Yep. She showed me one day. And she was also like, I'm thinking about putting a surgical suite in that house for back alley shit. And I was like, okay, Jesse.
I want to be a criminal.
I want to be a criminal. I mean, technically, am I still the most criminal person? Probably not.
No, but you do have a rap sheet there, Miss Fera.
I do, Mr. Palermo. You're dating a criminal. And one that got away with all of it.
I mean, God, my girlfriend got a warning for a traffic stop.
True, I did. Coyotes.
I mean, I don't blame him. If I pulled up on someone as good looking as you, I'd probably get more warning too.
Oh, hush. It was Pancake, and that was when he was in his, cadet phase.
Cadet giving a warning?
Yep.
Oh man, he was really into you.
Brother,
Pull
Oh.
pancake. I mean, I say pull, but sucker, but you know, still pull a pancake.
Okay, I saw the bunny that time. I'm not gonna hit it. No bunnies. No squished. Man, that rock did a number on my front bumper.
Oh yeah.
Oh well.
God, I wish I could just lift the hood up and see the engine. Oh, you can.
Mm-hmm. Everything looks to be in perfect condition.
I admit to you something that beautiful.
Hmm.
I think if we ever can do it, I think trying to take someone's catalytic converter is gonna be really funny.
Wait, is there actually one?
I don't know. Let's see. No.
Dang it.
I see your problem there, sir. You ain't got no fucking radiator.
I know what's wrong with it. Ain't got no gas in it.
You ain't got no gas in it. I see your problem, sir. You ain't got no turbo.
Nope, no
Every car needs a
turbo,
turbo to
stock
work.
engine. Stock everything.
At least these pots don't degrade.
True. That would be a pain in the ass.
Ain't that a sight?
Hmm? Oh, did I match my truck? Teehee.
Also, pretty girl on a pretty truck.
Oh, wow. Oh, that reminds me. Do you want to investigate further up the train tracks like we intended to do the other night?
Ooh, I'm down.
Whilst we have no place else to be?
And those deers do not fear anything.
Nope, they do not.
Oh, wow.
Wow, indeed. That is a beautiful view. And
Oh,
that is a
yeah.
plane.
There's the lumberyard.
Mm-hmm. Oh, bunnies! I missed them. It's fine. A camper.
And post business light.
Mm-hmm.
Oh, wait. They're in Polito.
Oh, we are in Polito. Hmm. Well, I mean, our kind of pancake plan is kind of defunct since we know what kind of folks live in Polito, but if we were going to come here, we would be in disguise anyway, so...
Yeah. You know, Polito's a really nice place, too.
Yeah, it is.
Kind of sucks that there's a literal sex cult up here.
Mm-hmm. Farmland.
You know, down the line, if we do want to get one of those houses, I think Grapeseed would probably be the best place.
Yeah, I'm agreeing with you on that one. It probably would be smart at this point to scoot back down to the freeway.
Yeah. Oh.
Gibby.
Get out of here.
Be gone. Go eat the hog that likes to stay around here.
God, please. What is this?
I don't know. We can take a look.
Yeah.
Don't look at me. This is fine.
I guess we're a lot similar in multiple aspects.
Maybe. I was looking at the GPS. I was. Oh. Blaine County Fire. Hey, y'all. Oh. So this is where you can clock on to be a firefighter. So it's probably one of the, The EMS departments can come up here and grab fire trucks and things.
That's really nice.
Mm-hmm. See? You can see one of the fire brigade ambulances in there.
And this is where, this is the one that, what's his name was driving?
Mm-hmm. Clark.
Clark, yeah. Let's see what
trash
the...
can.
Yeah, that's got same brain. They're too clean. Oh my god, look at that one.
Yep. That's a beast of an RV right there.
Mm-hmm.
Why is it there's never any trucks open? Why?
What do you mean? Food truck?
Well, I say that. It looks like there's two, Papa Dom's and the taco place. But they're both in
Ooh.
city.
Yeah.
Yeah. The city, ooh.
Yucky.
Not like we both work there and commute or whatever, but ooh.
Yeah.
I might swing by just the local burger shot guy and get a cheeseburger.
I mean, if you want there, I could drive back to the city and grab some stuff.
Yeah, but I don't want you to have to do that. Actually, is there a DMV worker on duty? Nope. I was gonna get you a copy of the keys for my truck. So you could have it if you needed.
Get you a copy of mine too.
I have a lot of muscle spasms, okay?
A lot of muscles too, apparently.
Yeah, I'm buff as heck, bruh. Exceptionally buff.
Oh yeah.
Oh, you know what I should have said in response to that email chain?
Mhm.
Ass thick like a pumpkin, no wonder Geo likes it. That's what I should have said.
It's not too late.
True, it's not too late. I could be a little shit.
I think you should.
I could.
Because I have the perfect thing I could send with.
Yeah. Let me get us to the burger shot so I'm not hangry or whatever. Honestly, I think you're right with grapeseed, but even a house on this side of Sandy wouldn't be terrible.
Oh yeah.
Yeah. I would much prefer grapeseed, but...
Sandy isn't the worst place either.
Hi there, sir.
Hey sir, can you give us those prices up there?
Wouldn't that be nice?
$173 for a 2 and 2.
Oh, it hurts. Oh, the pain. Where's our food truck?
I'm so
I
hungry.
never
wanna
thought I
know
would
which one
miss...
stole.
I never thought I would miss risotto so much.
miss my pollo a la milanese.
Mm-hmm. We were gonna do something. What were we gonna do? Because I just brain farted.
I don't know.
Oh, I was going to respond to an email chain.
That's what it was.
It is done. Oh, Coyote, please. Mr. Palermo,
Yes, Miss Fera.
would you feel at all inclined this fine evening to continue filling up your ice chest with fish?
I would love to.
That sounds wonderful. How about we park the truck by the RV and we take our happy little footpath down to our fishing spot?
That sounds amazing.
Wonderful. That's the one thing about living up here that stresses me out is that pack of coyotes. Because I'm always like, please, I don't want to hit one.
You know, you could always just ride up the mountain.
I could, but now this is muscle memoried into me is coming up this way.
Yeah, same.
Yeah.
Before we get situated and started on that, I'm gonna stare at my phone for just a moment.
Yeah, it's no problem. I have to unlock the camper and everything anyway. Nearly back up to 10K. Alright, got the lure on there. Got my food. My gun.
Sorry, that's
No need to apologize. Your fishing stuff is in the crate inside.
bet.
Mm-hmm.
All right.
Alrighty. Got her locked up.
Let's go.
Mm-hmm. We can take a nice stroll.
Nice little stroll.
A stroll. Us and the deers and the rabbits and soon to be the fishes.
Cool.
Mm-hmm.
Oh yeah. Look at this, by the way.
Oh yeah? What is that? A fish?
It's a fish.
What kind fish?
This is bluegill.
Bluegill.
And now I throw it back in my ice chest.
I didn't even know you could reach into an ice chest and just hold a fish.
Nope. Want to know how I found out about that?
Please enlighten me.
Jasper and Jules were dressed up as Jesse and James. It's like, yeah, we're gonna get these fish and you splash on people.
Oh my god.
So, you know, if we can't find business, maybe we advertise chest full of fish you can throw at people for $1,000.
Honestly, the sad part is that would probably get more sales than selling
yeah.
it to food businesses.
Projectile fish.
Mm-hmm. Have someone you hate. Here's some nearly rotten fish to throw at them. All for the low cost of 40 fish for $1,000.
$250 if you want the chest.
Yeah, true. How much is that per fish? 1,000 divided by 40. 25 a fish?
20, yeah, somewhere around 25, 20, 30, somewhere.
Mm-hmm.
Wait, why am I even... We have a calculator on the phone here.
True.
Yeah, 25.
Oh, okay. Gasp.
Right
Not
on the
doing
money.
mental math, imagine.
God, I wish I could do that these days.
No, I'm with you on that one. I used to be able to a lot simpler than I do now. Drone.
Damn drone. Get out of here.
Get out of here. Be gone.
I just had a very cursed idea.
What's
and
that?
my curiosity is gonna tear me down if we don't try it at the very least.
Mm-hmm.
Let's get near the water first.
Fair enough. Oh, are you wondering if you can throw them back?
No. It's
No?
something different.
Okay.
I'm kind of hoping it doesn't work, but if it does, it's gonna be funny.
Oh no. I pale in what you might be thinking. That wasn't proper English. I'm worried about what you might be thinking, is what I meant to say.
It got past my southern brain. I don't care.
Mm.
I understood what you were saying.
Yep.
Okay. Now, bear with me, okay?
I'm listening. And observing.
I want you to try.
Oh? Wait, what am I supposed to be trying?
See if you could throw your fishing rod from me.
Oh. Technically,
I hate
yes.
I hate that it worked.
Technically, yes. Not prettily. Or cutely. But technically, yes.
God, that's funny.
Mm-hmm. It's fun. You think it would work, but like I would just kind of have to twist my torso around. Because if you can sit and use your fishing rod.
I mean, it would really depend on what type of rod, honestly.
True.
Also, man, that emo change is really funny.
Yep. It is.
I have another banger in mind, actually. Hold on.
Mm-hmm. My first thought went to forget cake. Jess has all that pumpkin pie. Dense.
Dang it.
Dance.
Alright, this might take once.
You're good. The catch is fighting.
Okay, it's really scuffed, but it got the message.
Yeah. That is a banker. They're the same picture.
They're the same pic.
I love how the email chain has changed from "Oh no, Jesse" to Jess's ass.
Oh yeah.
Mm.
You see what Joey put in there?
Mhm. God, that's so funny.
I swear to God.
Oh, approval from the queen herself.
There we go.
Heck yeah. Success. Well done, Santi. Well done.
Thank you, thank you.
Mm. You want to know something a little bit stupid?
What's that?
I'm gonna be in my apartment tomorrow, FaceTiming with my family for Thanksgiving. And then I'm gonna be pulling up my phone to Rin on a warpath and a bunch of memes about Jess's ass. And I'm gonna be like, yeah, Dad, thanks. I will, you know, mentally take some turkey. Thanks for sending me at the table. What am I looking at on my phone? Don't worry about it.
I feel like I'm gonna be in the same situation as you.
Yeah.
But probably a lot less often, because man, sometimes in my apartment, the internet connection just goes bad.
Yeah. Sky, don't look over my shoulder. You don't want to see, I promise. Honestly, if there was any kiddo who could look over my shoulder, even through like a computer screen when they're halfway across a continent and an ocean, it would be that kid.
Oh.
Yes, that is an Amogus. Why do you ask?
I keep staring at it because it just looks like a bean, just a yellow bean.
Yeah, it does.
That was a GIF I took a screenshot of and just had the perfect time.
It's amazing. It's perfectly amazing. Well done. Well done.
Oh my god, my face is getting sore from smiling.
Honestly, it's probably a really good thing I'm not going home for Thanksgiving this year.
Why is that?
Well, I have 3 new tattoos that none of my family knows about.
Oh yeah, that would probably be a little difficult to explain. Huh?
Mm-hmm. Not that they would see the one on my back, but the one on my arm and on my leg, probably. It's hot as heck still in Alabama this time of year.
Yeah.
Which I'm sure you being from Texas and all, I'm sure you have the same.
Yeah.
Yeah.
Except, you know, being Hispanic and all. Thanksgiving is very much more, you know, nice suit, hat, boots.
Mm-hmm.
No shorts, no short sleeve shirt.
Oh,
It's
yeah.
the killer heat plus that.
Oh, goodness.
But you know what? I'll be a sucker if I miss those tamales. I'll be real with you.
Oh, 100%, I'm sure. I know, I don't know how I'm gonna stand it this year without, like, the dressing, my grandma's recipe. I just got some of that stovetop stuff to cook in my apartment.
Yeah.
Yeah. To be honest, I'm not sure if I'll come out of my apartment tomorrow or not. It'll just depend on how tired I am after the video call and stuff.
I have no idea if I'm gonna even be able to. There's a high chance, well, I guess a very low chance I might.
Mm-hmm.
But like you said yourself, depending on how I feel.
Yep, 100%. Well, I mean, if it's any consolation to the two of us, if the city was really chill today, aside from the obvious, it will likely be chillier tomorrow.
True. God.
Mm-hmm. It wouldn't shock me if the only doctor on duty tomorrow's Nancy pretty much all day.
That wouldn't surprise me, actually.
Mm-hmm. Probably not a ton of PD around either.
Oh, that's a good point, actually, yeah.
Yep. Unless they're a bunch of Canadians.
Or the British.
Or the British.
Yuck.
Gosh, the British. Oh, no one will be around to stop her in. Oh no!
Yeah.
Her Britishness! It's our curse! We can't get to her in time!
That British brain fuck.
Mm-hmm. I meant to throw out my fishing rod, but instead I whipped my iPad out of my pocket.
iPad kid.
iPad kid, iPad kid. Can't take in nature without a screen. Man, talk about meta commentary. Anyway.
God, I know, right?
Ugh.
Jesus Christ.
Ugh. Sends a shiver down my down my spine.
What?
The email chain again.
Yeah.
Yeah. That's what I should get Gio for Christmas. A pumpkin. just buy some pumpkin seeds if I can find them. And just plant up like 4 or 5. Somehow break into his car and just line the glove box in the trunk with pumpkins.
Oh my god.
Does Farmer Bob even sell pumpkin seeds?
I think he does actually.
Oh my god, does he? Oh, I have morbid curiosity. I mean, Grapeseed is just around Calafia Way.
That is.
Honestly, we could come down and take the salt flats and it would probably be faster than taking the road. Just scooch on up to Farmer Bob. Be like, hey Bob. Got any
Hey,
pumpkin
Bob.
seeds? It's for a friend. Oh, Santi.
What's up?
I had an evil idea, but I need to do some illegal testing.
What does your brain have in mind there?
So if the pumpkin seeds do exist, right?
Mm-hmm.
1, I need to see what it looks like when they're fully grown. 2, if it looks like a pumpkin in the ground when it's fully grown.
At PDM?
Yes. Instead of the onion. We leave pumpkins everywhere.
God, you are the perfect woman.
He'll never escape.
He will never escape.
He'll never escape the pumpkins. It's nearly 2 a.m. and I need to go to bed because my video call's early in the morning, but I want to check and see if these pumpkin seeds exist. And if they do, I'm probably gonna buy like 10.
Oh my god.
Because even if the pumpkins when they're growing in the ground don't look like full pumpkins, when we pull them out it sure as heck will, and I can still put them in his trunk if I catch him unaware.
I mean, all it would take from me is, hey Gio, can I borrow your car keys for a sec?
Yeah, exactly. You are the perfect partner in crime.
Mwahaha.
Yep. I wonder how often he looks in his trunk/glove box. Because the pumpkins could theoretically stay in there until they rot and he wouldn't notice. Until he goes to put something in there. And there's just pumpkins everywhere.
You know, if you lay them in a... just stuff them in there, right? You can make it look like a smiley face.
You are 100% correct. It's perfect.
We
Perfect.
are too dangerous together.
We are. That's why we're perfect.
Exactly.
Come, Mr. Palermo, we must away to Farmer Bob. To Grapeseed.
To Grapeseed.
To Grapeseed. And then more than likely to Eep.
To Eep.
To Eep.
To Grape. To Grape Eep.
To Grape Eep. To Eep or not to Eep? That is the question. I should know the rest of that, but I don't remember it from like 10th grade English or whatever.
That's the only part I remember.
To be or not to be, that is the question. Yep, I'm blinking. I thought I knew more. I do not. I'm gonna toss my fishing stuff in the camper right quick before we head out.
Ooh, yeah, good idea.
Yeah. I must have room to hold the seeds, Mr. Palermo.
You only grew up in the seeds, Mr. Palermo. I was born in it.
I was born in it. Molded by it. Actually, I probably really need to stop calling you Mr. Palermo, because I could also be talking about Gio. And that...
Don't tell me you've been calling my cousin Ansem this whole time.
No. God, no.
Yeah, I can log.
Okay, thank you. So here's the question. Would you like to rip and tear around the salt flats in your truck or in my truck? It is up to you.
Let's do yours.
Okay.
Hey, our toolboxes.
I know. When I woke up this morning, apparently some locals realized and came and got them.
I hate them.
I hate those locals. Is it possible? Theoretically, yes.
Let's do it.
Theoretically, it went fantastic.
Oh, yeah.
Oh, there's a rock. Don't worry, it's fine. Next time, I will go the other way.
Is it
Here
'cause
we
you
go.
almost oceaned up the truck.
Maybe. I was trying to do a wicked 360, but I forgot how to. Gosh dang it.
You got this.
$360.
Wow.
Wow. Let's see, where is one Farmer Bob? There's a murder kitty.
That's not a farm pop.
Nope, it is not. Oh, okay. He's further into Grapeseed. For some reason, I thought he was on the outskirts out here. That is a whole grave. I am not going in there. No desecration for me. No, sir.
Joey's calling me, but I do not have the energy to start that conversation.
Yeah, sad to say I don't blame you.
Yeah.
I have a feeling it'll turn out a lot like my conversation with Silver did earlier.
I think I'll have that conversation tomorrow. I'll just play it off like I was
Yeah.
asleep.
That's fair. Hey Bob, do you have pumpkin seeds? Ah! Oh, beautiful day. He sells pumpkins.
That was definitely a laugh.
Look in the glove box, Mr. Santiago Palermo.
They are perfect.
10, count them, 10 pumpkin seeds for our use in mental torture.
It's just absolutely perfect.
Perfect. Just perfect. Everything down to the last minute detail.
And through the salt flats we go.
That we do. Gotta hang a little bit closer to the leftward side this time.
Oh, yeah.
Wicked.
Wicked. Still just upside down.
Yep. Let's see, is there a pretty good... Yeah, right here.
Whee.
A goat. This thing is just a goat. Oh, I love this truck so much.
It's just so nice everything worked out with
Yep.
the pumpkin seeds.
100%. I don't want to hit the rabbits. I want them to run away. I'll probably just leave the seeds in my glove box for now. That way I'll have them. But it's perfect. Actually, hang on. I need to test one. one illegal pumpkin seed.
Gas.
So we shall see.
So we shall see.
By the time we wake up tomorrow, it should be grown. Or if we wake
Hopefully
up tomorrow.
hopefully the deer or bunnies don't eat it.
Well, if they do, I have 9 more test subjects.
You make it sound so evil. Miss Super Villain.
Oh, I'm just full of malice. So much malice. So much.
Just so evil.
Yes.
Evil Indy.
Indeed. I am the most evil creature on this planet. Surely. Certainly.
Certain.
Hmm. Good night, Santi. I'll see you tomorrow.
You have a good night.
Oh, they're so cute. Oh, and he's so good to her. She's a horrible girlfriend. She really is. Oh, they're so cute.